All right. All right, everybody, welcome to the Appropriations Committee. We have a lot of bills today, so it's going to be a little bit of a long day. I want to remind witnesses that you have 2 minutes to testify. Bill sponsors have as much time as they need. Additionally, bill sponsors are permitted to bring their panels forward, but when you get there, we'll need to know the names of the panels so we can mark them off the list. With that, we're going to start with House Bill 424, Delegate Simpson, State Retirement and Pension. And I know, welcome to bring Ann Galthrop up as well if you want.
Our lovely panel. Make sure I'm on the right one. All right. Since this is my first time in appropriations, hello. So thank you, Chair Barnes and Vice Chair Chang and all the honorable members of Appropriations Committee. I hope you will all be my Valentine and provide me a very favorable report on House Bill 424, State Retirement and Pension System, non-vested accounts, regular interest. I was encouraged to be brief. So in short, what this does is if somebody we have their money or the retirement agency has their money and they can't take it out, it will provide interest to them. It is very similar bill to the bill that was passed in 2018, but the bill in 2018 was only related to the alternate contributory pension system, and this would apply to all. We do know there is about 2,900 individuals that this would affect. So not only would I like you to be my Valentine, I would like you to be their Valentine and do what's right and pass this bill. So I humbly request a favorable report on House Bill 424. Thank you.
Any testimony, Ms. Galthrop?
Just here to answer questions.
All right. Are there any questions for Delegate Simpson? Don't see any. Welcome to Appropriations. Thanks for being with us today.
Thank you. You guys are so kind.
We'll get you next time. We'll turn to House Bill 421, Delegate Grammer.
Perfect timing. Mr. Chair, members of the committee, for the record, Delegate Robin Grammer here to present House Bill 421. House Bill 421 limits the management fees that the Board of Trustees may pay to external asset managers in a given fiscal year to 0.2% of the value of assets under management. For the 2022 fiscal year, we spent $932 million in management fees for our state pension system, over 1.5 of the fees under management. We have spent over $6 billion in management fees over the last 10 years. This is serious money taken from our pension system. The compounded numbers are even higher. Over the long run, high management fees kill performance. Such a high rate of management fees has a significant impact on the long-term returns of our pension system. House Bill 421 would require us to pare down the level of funding permitted for management. We should be wary about strategies that push our investment strategies out the risk curve. The significant losses in Maryland's pension portfolio have been buoyed by reported gains in private equity and real assets. With the perpetual threat of recession over our heads, we should note that these are more risky investment options that can falter in times of stress. We should also note that they tend to be less liquid investments where the closing value can be radically reduced in times of stress. Most of the weightings in our investment system can be replaced with a lower fee benchmark investment, which would allow us to fold what would otherwise be management fees back into our fund. This is potentially hundreds of millions of dollars that we could roll back into the fund. The status quo is expensive for taxpayers and retirees. States such as Nevada, who lean on a lower fee structure, have achieved higher returns, and we can achieve the same thing by pursuing the same goal. So I'd be happy to take questions and ask for a favorable on House Bill 421.
Bill sponsor, Delegate Watson.
Do you know what the current fee structure is? And can you tell us?
it's more than, I don't think it's defined on a percentage basis, but it certainly allows for fees over 0.2%. In fact, in some cases, much higher than that.
But you don't really have like an average or anything like that?
Well, if you look, I would advise you to look through the investment portfolio, which is, there's a lot of different strategies therein. And I think some of the investments are individual stocks. There's a lot of different things that the money's put into. And some of the investment strategies, I think, I think the portfolio actually quotes fees as high as these are return-based investment options, but some fees are over 3%. So I don't think it's defined on a percentage basis that applies unilaterally to the whole portfolio. Thank you.
Thank you, Mr. Chairman. So two brief questions. One, what's the significance of 0.2%? Why is that the threshold?
0.2% tends to be what a lot of indexes, they fall right around that range. For example, the S&P. For others, such as the Russell, you can actually get below 0.2. It's 0.19.
Okay, and then this seems very familiar. I've been here as long as you. Have we taken action on this issue before?
Delegate Chairman Barve and I worked this issue several years ago. This was prior to COVID. We looked at fees. At that point, I think the bill that was passed was we had to disclose the fees. Some of the fees were undisclosed. We limited the bill. We pared it back to we had to disclose all the fees. That bill at the time also required that we pursue strictly passive investment options. That was amended out of the bill. The bill also limited the fee structure down to a certain level, such as just like this bill does. But all that was taken out. The only thing that we actually passed was that they actually had to disclose all the fees.
And they're complying with that? Those are
yes.
Fees?
Yes.
Okay. Thank you. Thank you, Mr. Chairman.
All right, Delegate, thank you.
It's good to see you.
Have a good day, you too. We have an unfavorable from state pensions. I think Andy Palmer is here, our investment officer. Welcome.
Delegate Barnes, members of the committee, thank you for hearing the testimony from me. This is Andrew Palmer, the Chief Investment Officer for the pension system. I'm here to testify in opposition to this bill on behalf of the Board of Trustees. We've submitted extensive written testimony that provides detailed reasons why this bill would be detrimental to the system and potentially harmful to the beneficiaries. Just to summarize the testimony, the board is the fiduciary responsible for protecting and growing the assets of the several systems to pay benefits when they're due. The board recognizes that fees, if they're not providing substantial returns or diversification benefits, are inefficient, and we work to minimize those. But the nature of the pension system, being a mature plan that pays out a percentage of its assets on top of greater than any contributions during the year, every year, makes it imperative that we build an investment program that limits how much we can fall in any one year, because it makes it really hard if we're paying out dollars on an ongoing basis to achieve and maintain a fully funded pension, which is our long-term goal. The way we do that is by diversifying across asset classes, across geographies, the U.S. and other geographies, and within public and private assets. These come with different costs associated with them, and it helps us build a diversified portfolio that helps us achieve those loss mitigation effects. This bill would effectively limit the range of investment options available to the board, and it would increase the probability of large losses and decrease the probability of achieving our long-term investment objectives and of maintaining a fully funded plan. 2022 is an example. The system's assets lost 2.79%. A portfolio constructed along these lines, recommended by the bill, would have lost about 13.3%, which is another $6 billion in losses, which would have had to be made up in part by additional contributions over time. So we'd ask for an unfavorable report on this bill.
Questions for state pensions? Delegate Watson.
Is there a cap now on the external investment fee that you can pay?
There's a cap on the assets that are for public bonds and stocks of 50 basis points.
Or 0.5%?
Yes, 0.5.
And this legislation is asking for it to be 0.2%.
And it wants to go further than that because it wants to include assets that are not just public bonds
In
and
real
stocks.
estate and
Real
so on.
estate,
Okay,
yeah.
thank you.
All right, I don't see any other questions. Great to see you, Mr. Palmer.
Thank you.
Thanks for your good work. That concludes the bill hearing on House Bill 421. We'll move to House Bill 458. Don't think Delegate Lewis is with us, but I think Chairman Casemeyer is here with his team and can present the bill if I understand correctly. Mr. Current and former Chair, great to see you.
Thank you, Mr. Chair.
Yes, sir.
In front of you. Thank you all. First, I want to introduce, I'm Ed Casemeyer, Chair of the IAC, and to my right is Alex Donahue, who is our new Executive Director, and to my left is Cassandra Viscara, who is our Deputy Director. Very, very competent people, really good people. I want to thank you and Delegate Lewis and everybody else for sponsoring this bill. Back in 2018, the 21st Century School Facility Act, to a great extent, made the IAC an independent body. However, they really didn't make us totally independent. And what this bill does is sort of completes that task in that it enables us to do our own IT, our own HR, finance, excuse me, any sort of the back of the room duties that up until now we've had to go to MSDE to get personnel action taken if we wanted to hire new people. And it makes it a very, very lengthy process to get that accomplished. So this bill does a couple things, but the main thing is that aspect of making us totally independent. And just so you know, the superintendent couldn't be here, Superintendent Chaudhry, but he's very supportive of this and actually sort of the one that urged us to do this. So that's basically it. I think Alex has a few comments to add.
Thank you, Mr. Chair, and thank you, members of the committee, for this opportunity. There have been a number of statutory changes since 2018, including the Built to Learn Act. In completing the process of moving the IAC to an independent unit of state government, we greatly support the 9-member commission for a mix of appointed and ex officio members in executing these expanded responsibilities. The IAC strongly supports this bill because it would help us do this work more efficiently and effectively. And it will also, as the chairman pointed out, will allow MSDE's administrative support units to focus better on their own agency's needs rather than ours. If you have any other questions, happy to stand for those.
Thank you. Don't see any opposition to the bill signed up. Are there any questions from the committee? All right. Mr. Chairman, always great to see you.
Thanks a lot, Mr. Chair.
Yeah, have a
I
great
want to say
day.
hi to my fellow Howard County and Delegate Watson. She does a good job.
Happy to have Howard on the committee.
Thank you.
That concludes the bill hearing on House Bill 458. Still don't see Delegate Lewis, so I'm going to pass 464 for one moment and go to House Bill 407. Is Delegate Fair here? Mr. Simmons, are you able to do Delegate Jazz Lewis's bill?
Yes, sir.
Okay, well, come on up. It's good, great to see you.
Good to see you as well, Chairman.
Yeah. Walter Simmons from Floyd Prince George is favorable on the bill.
Chair and committee, I am testifying in favor of the bill. What we are trying to do in Prince George's County is change a culture that doesn't continue to penalize people with criminal convictions and ex-offenders through an incentive, by incentivizing employers at a rate that would allow them to pay people a livable wage with a minimum of 21 hours a week, and then they would be able to receive up to $5,000 per year for the returning citizens that they employ and maintain employment. And the goal behind this bill is to, one, help businesses that are hiring returning citizens, businesses that have historically struggled in our area coming out of the pandemic, as well as helping a large population of unemployed residents secure livable wage employment and maintain employment.
Simmons is breaking down the bill, but if you have anything else to add.
Me too.
Great. The committee should know Employee Prince George's does just outstanding work in Prince George's, so thank you for the work that you do. Are there any questions for this panel? Okay, I don't see any. I think we do have, thanks for being with us, Mr. Simmons. Thank you. We do have Christopher Dews here as well to testify, if he's here, or? All right, doesn't look like it. All right, that will conclude the bill hearing on House Bill 464. Is Delegate Fair with us now? Hey, welcome. 407, House Bill 407.
Thank you, Mr. Chair, and my apologies for literally running in the door.
You did great. Thank you.
Mr. Chair, Mr. Vice Chair, I'm proud to be here to present this bill, which is actually a really simple bill, as I'm sure you might have heard before. The bill simply deletes one word, which is the word "not," out of the current existing regulation and policy, and this basically surrounds property assessors. I'll mention that we've been working this evening with our partners this past evening at MACO on a friendly amendment. This will simply remove the opportunity for counties to provide property assessors the option for salary enhancements, but instead will focus simply on fringe benefits. So what does a fringe benefit look like for a property assessor at SDAT? That could be something as simple as a bus pass, something like a parking space, either that's street parking or county recognized parking space, things that currently property assessors are barred from being able to be given by their counties that they present in. And so with that, I will turn it over to my partner over here at SDAT to help fill in any of the gaps.
Thank you. Yes. Daniel K. Phillips, State Supervisor of Assessments for the Real Property Division of the Department of Assessments and Taxation. Thank you, Delegate Fair.
All right, I have Director Higgs on here, and
I'm appearing for Director Higgs, please.
Okay.
He's in another hearing at this time.
Go ahead. Yes, sir.
So, Chair Barnes and Vice Chair Chang, HB 407 is enabling legislation, permits counties to provide fringe benefits to assessor. We do not anticipate that this would be any fringe benefit that's not really available to state employees, but would be minor items such as parking, bus passes, and all of that. Many of our employees are working in county office buildings, so this would allow them to have parking spaces nearby. The department is in full support of this legislation, as it gives counties greater flexibility to provide benefits to our staff that are charged with real property assessments for the county's residences and businesses. SDAT strongly urges a favorable vote on House Bill 407. Thank you.
Department assessments, are you testifying for him as well?
Yes.
Excellent. All right, that concludes the favorable. Are there any questions for Delegate Fair? Delegate McComas.
Thank you, Mr. Chair. I'll be real brief. I know I've heard of some of the budget issues for SDAT and the fact that you're doing a lot of training of wonderful assessors and appraisers, and they go elsewhere to DC, Montgomery, Prince George's. So do you really think a parking space or a bus pass is going to help really in the long run of the situation?
I think that it's one piece of a large puzzle. I think that we have heard very clearly, in Ways and Means Committee, we've heard very clearly from our partners at SDAT that they do need more support at the state level. I think that this is one step in that process. Other organizations would stress that we should not be putting the onus of the challenge back on counties by providing things like salary enhancements and things like that. And so I think that this helps to provide one small solution and remove one small barrier in that process, but I do think it's a larger conversation, Delegate. Absolutely. Thank you.
Did I see your light come on? No? You said you're working with MACO on amendment?
Yes, we have a friendly amendment from MACO that was drafted last night, so we have not received a physical copy of it yet.
Well, you're not a real-life delegate until MACO's opposed one of your bills, so, so you're good now. All right, well, thanks for being with us. Welcome to Appropriations, and thanks for the bill.
Thank you, Mr. Chair.
Ms. January, we love you. Where are you? Come on up, MACO. Oh, she's virtual. We're going to get her on virtual. Right, she's coming in now. Ms. January, it's great to see you. You're on.
Thank you, Mr. Chair, Vice Chair, committee members. For the record, Brianna January, representing the Maryland Association of Counties Sadly, here virtually on HB 407, I unfortunately broke my foot on the mean streets of Annapolis last week. You do have our written testimony that outlines our concerns with the bill as drafted, which was mainly that salary piece of the bill. And as the bill sponsor noted, we are working together, and we understand that he does plan to submit amendments that would address our concerns and guard against any unintended consequences of the bill as drafted. We greatly appreciate us to do so. Again, MACO respectfully opposes HB 407 only as drafted, but we're optimistic on our concerns, and we know that they'll soon be addressed. Thank you.
All right. Are there any questions from Ms. January? All right. Well, we appreciate you, and get well soon, okay? Thanks for being with us. That concludes the bill here. 407, we'll turn to Delegate Bridges, House Bill 296.
Good afternoon, Mr. Chair, Vice Chair, members of the committee. This is Delegate Tony Bridges for the record. For House Bill 296, the Maryland Teachers and State Employees Supplemental Retirement Plans. This is all about automatic enrollment. I'm here with Rhonda Bell, the Executive Director and Board Secretary, as well as Deborah Roberts, the Deputy and Chief Financial Officer for the board. We know that there's a gap that exists between employees' pre-retirement income and post-retirement income. There are a number of individuals who do not automatically enroll into their benefits. And so in the first 90 days, what we are asking is that we have an automatic enrollment period. People can actually opt out in the first 90 days for automatic enrollment. But this is a great way for people to take advantage of the benefits that they haven't been taking advantage of. In fact, 25 other states in the country allow for some form of automatic enrollment in plans, but Maryland does not. DC actually is experiencing great success with 91% of new employees enrolling in their workplace retirement plan, while only 27% participate under the voluntary enrollment plan. And so after 3 years, 92% of those individuals who enrolled under automatic enrollment are still with the program. This is a really good program to help with benefits as folks enter into retirement. And Mr. Vice Chair, I know you're looking at me and you're thinking all that gray hair must be close to retirement age. In fact, I am not, but I'm going to get there one day. And I think this is a great benefit that'll help me out once I do get to that retirement age. And so I will ask for a favorable report, and for the details of the program, I'll turn it over to the chair of the board, the executive secretary for the board. One thing I will say is for colleagues, if you look into your system, you'll see that there are some favorables, which of course we love, but there are some favorable with amendments as well. And so I know that the board is willing to work with those individuals and organizations on those favorable with amendments. And then there are some unfavorables as well. And with those unfavorables, we think that there is a little bit of confusion, which the board can talk about as well. Thanks.
All right, well, good afternoon. It seems like I was just here, because I was. So, Mr. Chair, Mr. Vice Chair, thank you, members of the committee. I am Rhonda Bell, Executive Director of Maryland Supplemental Retirement Plans. And with me today is our Deputy Executive Director and CFO, Deborah Roberts. Our Board Chair, Eloise Foster, sends her regrets as she is unable to be here with us today. We appreciate the opportunity to come before you to discuss MSRP's strong support for House Bill 296. MSRP's Board of Trustees has a fiduciary duty to make all decisions with the best interest of plan participants as its guiding principle. I cannot overstate how seriously the board takes its duty to administer this critical state benefit. With that in mind, here's what we know. 39% of currently eligible Maryland state government employees are actively participating in MSRP. Auto-enrollment is a nationally accepted industry best practice, and the research shows that supplemental plans will greatly assist the average state government employee by helping to close that income gap that will exist for most between their pension and Social Security. Key national research study findings show Automatic enrollment provides the greatest results for the employees with the lowest salaries, with an 82% increase in replacement income for this particular segment. 94% of public employees who were auto-enrolled remained in the plan and had a 13% higher contribution rate than those who were not automatically enrolled. This legislation applies to Maryland state government employees hired on or after January 1st, 2024, and does not apply to local government employees such as those who work as teachers for county boards of education. Authorizing automatic enrollment will provide our employees with lasting positive outcomes. I want to extend my special thanks to Delegate Bridges for sponsoring this very important legislation, and I am requesting that the committee issue a favorable report. We are here to answer any questions that you might have. Thank you.
Okay. Here for questions, or did you have? No. Okay. Any questions for this panel? Delegate McComas.
Using my questions, but I apologize.
You might want to save them for later.
Oh, okay. There goes my bills. What I wanted to ask is we've heard about a lot of vacancies in government, and we've also heard, you know, that we need to raise the salaries in order to maintain employees. And I just wondered what your thoughts are if the people are automatically enrolled, and then let's say financial issues or something, you know, this is money that they can't use for their regular expenses. Is that going to cause a problem since our salary structure may be a little lower than it should be and is not competitive with other jurisdictions and counties and DC? So I just, and if they got into a situation where it was an emergency where they needed extra cash, you know, somebody's sick or whatever, are there exceptions that they could take some of that money out with maybe significant taxing implications?
So to your first point, the deferral amount is something that's going to be set by the Board of Trustees, but once someone is in the plan, they can increase or lower that as they see fit. In terms of unforeseen hardship and emergency, there are provisions in the supplemental plans for withdrawals, and they're done very quickly, and that is handled by our plan administrator, which is currently Nationwide Retirement Solutions. So we provide this state benefit with flexibility in mind.
Any other questions for this panel? I don't see any. Thank you. Thanks, Delegate. Great to see you again. All right. We do have a favorable with amendment. Denise Gilmore. Denise with us.
Good afternoon, members of the committee. My name is Denise Gilmore, and I'm a legislative director with AFSCME Council 3. We are favorable with amendments on SB 296. We full-heartedly support the intent of this legislation. We will be the first to tell you that too often our members are not able to retire as they should with dignity due to, honestly, a lot of cuts that have happened to our pension system over a number of years. Our only concern with this bill is the approach that it takes. It automatically jumps to an auto enrollment for the state supplemental plan. We would prefer to see us slow down a little bit before we jump into an automatic enroll situation. You know, as it stands, as the bill is written, you know, there's a yet to be determined fee that would be taken out of new hires' paychecks. Let's say they decide to set that fee at even, you know, $30 a pay period. That amounts to, you know, over $700 a year potentially that members are providing into the supplemental plan. We just simply don't think our, you know, particularly lowest paid employees in the state right now can afford that, given the rising costs and inflation. It would be our preference to, you know, do a study to look at this situation first. You know, I think we can, as the exclusive bargaining representative, we would certainly like to see seats on a board that ensures supplemental retirement. That's similar to what we have with our state retirement and pension plan. The exclusive bargaining representative gets to have seats on those boards. We don't have that with a supplemental plan. I think there's also, some work that we can do to look at fee structures. But more importantly, this issue of retirement readiness, it's something that's very dear to our hearts. It's important after a career of service to the state. Our members absolutely should be able to retire with dignity, and we think it's worth doing a study to make sure that we are, in fact doing that before we jump to an auto enrollment. So we appreciate the delegate, and his willingness to work with us on that, and we hope to work with the committee on making sure our members are as secure in their retirement as possible too. So, thank you.
Great to see you.
Okay, thanks.
We do have two unfavorable, Tony Whaley and Nathan Glassy.
Good afternoon, Chairman Barnes and the rest of the distinguished members of the Appropriations Committee. We're grateful to be here. My name is Nathan Glassy. I'm the Executive Director of the National Tax Deferred Savings Association, which is part of the American Retirement Association. We have over 30,000 members, and 822 of them are here in Maryland. And our role is of the NTSA is to provide high-quality education, technical support, and networking forums for all professionals in the 403B and 457B marketplace. In support of the teachers of Maryland, we oppose this bill and find the following four significant issues with the bill. There's a lot of things that we find very positive with the bill, but there's a couple of things that concern us. And one was brought up here just a moment ago. The teachers in the state already currently contribute 7% into the defined benefit plan. They then contribute another 6.2% into Social Security. So that's over 13% that they're contributing out of their paycheck right now. If we auto-enroll them at another 1, 2, 3, 4%, whatever that is, that's already well higher than most people are contributing to their retirement plans across the country. I'm not here to tell you that there isn't a gap. We believe that there is a gap for the majority of the teachers in the state. They need to contribute into the supplemental plans. We're here to support that. But to auto-enroll them without education, without training on what they can do and where they can contribute, can be detrimental to that individual. And so our suggestion goes beyond that, to provide the education from advisors across the country and in the state who know about the retirement plans and can work things through that way. So that's the second issue, is the reduction of choice for the plan products. Not knowing where they're contributing to. They already are put into the defined benefit plan, not by their choice, the Social Security, and then the supplemental should be an opportunity to contribute into where they determine that and have the advisor to support them, to educate them where they need to be. So along with providing retirement education to each employee, we feel that preserving participant access to an advisor is vital to the success of each individual participant's retirement goals. That's where we support. We'd love the opportunity to discuss more and work with the delegate and state representatives on this, and we're here to support in any way that we can. Thank you.
Thank you very much, Mr. Glassy. Are there any questions for the panel? Thank you very much. That ends the bill hearing for House Bill 296. Next, we'll move on to House.
Okay. Can we hear from Tony as well?
Okay. Actually, we're sorry about that. We're going to hear from Tony Whaley. Please, 2 minutes. Thank you.
Thank you so much. Thanks for the opportunity to be here, honored members of the committee. I'm speaking to you today as a part of the system. I am a representative, small business owner that works with the participants in the state of Maryland and have a combined total experience with them for over 45 years with my team. On its face, auto-enroll has a noble intention, and it seems logical that making the decision for the employees will somehow telegraph that good intention that it's supposed to convey. But mind you, as we've talked about, it's not a new idea. We already do the pension and the Social Security, so this is just another idea on top of what's already made for the decision for them. We're opposed to the auto-enrollment because it seems like a one-size-fits-all, and it just doesn't really speak to the issue here today. We agree that employees do need to participate in their elective supplemental savings program. It is essential so that they are able to increase their retirement and to prepare for the unforeseeable obstacles that their retirement lifestyle will possibly incur. That's why we, as an organic part of the system, show up to work every day. We're committed to these people. However, we do know that there's always room for improvement. In our written testimony, we've suggested some ideas that will increase participation and enable employees to retire on time and on their own terms. Simply put, win hearts and minds of more individuals by convincing them that it's in their best interest to save. They need to want it. Then we need to stick with them, convincing them to stay with it consistently, and then to not touch it until they actually need it for retirement. Please consider enhancing the current system as it is to allow access daily, during the day, workday, time to engage with their financial professionals to make sure that they're on track. Keep the decision in their court and let them retire on their own terms. Thank you very much.
Any questions for this panel? Delegate Bridges? Thanks.
Thank you, Mr. Chair. Just a question regarding the teachers. Do you know how many teachers are actually enrolled with the MSRP plan?
I know how many are enrolled in our plans in the 6 counties in which we actually work, and they range from 25% enrollment as much as 27%.
But those are at the local level. These aren't the state retirement plans. Is that correct?
Yes, it is correct.
Yeah, thank you.
Yeah, contributing to the supplemental plan, correct.
Thank you, Mr. Chair. Just for the record, you are comparing the defined benefit plan with, as I took it, a defined benefit plan with an automatic enrollment. Where would the choice from the individual be removed if they could just opt out of the plan once they were enrolled?
So the issue with removing choice is when you auto-enroll someone into the MSRP plan, the supplemental plan has options for different vendors, different contribution amounts, different plan types, pre-tax, Roth, all of that are all options for a participant. And when you auto-enroll, you make that choice for them. You say you're contributing to MSRP at this percent. Of course, you can change your percent up and down, and yes, you have 90 days to opt out, and then you have the rest of your life to choose, I don't want this plan anymore, and I can go into another 403B plan or whatever you want. But auto-enrolling someone into that, we know that the majority of people stay, whether it's good for them or not. And that's a positive thing. I mean, we want people to work towards retirement, and auto-enroll does help with that. But with a supplemental plan is outside of that, similar to like an IRA or anything like that. This gives you the option for the participant to choose where their assets are, to choose who they work with, and help move things forward that way.
Do you know what percentage of 22 to 30-year-olds, 20 to 30-year-olds enroll in a retirement plan on their own?
A very small percentage enroll on their own. It really is. It's in the 10 to 18% range of that age range are contributing to to choose that supplemental retirement plan. That's one of our concerns with this as well. Is can they? I mean, yes, they should. For example, my daughter, she's 19 years old. She started working somewhere and she had an auto-enroll plan, and I ensured that she signed up for the auto-enroll plan or didn't opt out of the auto-enroll plan because she needed to do that. She didn't, where she was working, she didn't have a defined benefit plan. So she was contributing only to Social Security and nothing else. So when I jump in here and I say, okay, we have the defined benefit plan, we have the other things, can we really add more onto that participant? Where auto-enroll helps is, yes, there is a gap, but where it hurts is there's no education from someone like Tony to come in and say, we're going to help you learn what you need to do specifically for you individually to work towards retirement, whether you need that or not, or whether you need to contribute more or less. That education has to come from a professional advisor.
So my last question, if I may, Mr. Chair, is, I guess we just heard, it's a question in the context of, in one part, very low percentage of 20 to 30-year-olds enroll on their own, what you just said. On the other hand, we shouldn't auto-enroll them to allow them, and then allow them to opt out. If we follow your idea, would that maintain the percentage of 20 to 30-year-olds not having a retirement plan set up?
What we would like to do is we would like to push the current program how it is now and increase education for those participants. We need more advisors. We need the advisors on the ground to be able to take care of every teacher, provide education opportunities so that they can educate the teachers what they need to do to work towards retirement, starting right at 18 years old, right when they start into the workforce. They need to meet with someone like a Tony to do so.
May I also add that 7 out of 10 people who do sit with a qualified financial person who can advise them actually sign up. So it is effective. We just need to do more of it.
Okay, I don't see any other questions. Thanks for being with us.
Thank you.
That'll conclude the bill hearing on House Bill 296. We'll turn to House Bill 477, Delegate Kelly and Delegate Smith. As they move forward, I want to welcome Delegates Riley and Rosenberg from HGO. If you all have questions, just let us know. We'll please forward. All right, and Delegate Kelly, Delegate Smith, if you have a panel, feel free to bring them forward. Just make sure they introduce themselves.
Okay, we're good. We're going to have a couple of students join us, so
Great.
They're coming up, and it will be Isha Yardy, Caroline Thorne, and Jakia Johnson, who's right here. We need another chair.
And there's a chair here. I can switch over when I'm done.
Okay, wonderful. Thank you so much. Thank you, Delegate Smith, for joining me with this bill. Thank you all. I'm so excited to be here in my second favorite committee today. This is House Bill 477, Public Senior Higher Education Institutions Reproductive Health Services Plans. And I would very much like to thank Delegate Smith for joining me and introducing this bill, and hopefully I'll be passing it off to her shortly. You do have some sponsor amendments that you should have that we are submitting at the request of the University Systems of Maryland, which I'll talk about in a minute, and just want to make sure the committee knows that I'm delegating all of the negotiations on anything necessary with this bill to Delegate Smith and the committee. I trust you all. You're the experts on higher education. I am coming to you here with an idea related to health care that came to me from a student at Bowie State University that you'll be hearing from in a minute. This is legislation that's part of the reproductive freedom package that we introduced last week with the Speaker, Senate President, and Governor Moore. This is the bill that requires our public 4-year institutions of higher education to develop a reproductive health services plan by August 1st of 2024, and also to ensure 24-hour access to emergency contraception. These plans can be developed in consultation with MDH if necessary. We're not trying to create any unnecessary burdens, so they can be a resource for the schools if they need them. They're not required to consult with MDH. And with the exception of emergency contraception, I want to make really clear that the healthcare services don't need to be provided on campus. We're just asking that the schools develop a plan, and services can be provided through a referral network. So that's what the bill does. In terms of emergency contraception, the legislation requires 24-hour access, which can easily be accomplished through a vending machine or stocking EC on-campus retail stores. As I mentioned, there's an amendment from the University System of Maryland. I want to read to you from their testimony because I think it was really getting to the point of why we want to do this bill. They say an unwanted or unplanned pregnancy can prevent people of both sexes from finishing school, leaving students with loan debt, no degree, and fewer pathways to career and salary advancement. It's very challenging for students to access Plan B, for example, or other forms of emergency contraception, as most college campuses' health centers are not stocked with it. Even the few on-campus health centers that do have EC have limited hours and are usually closed on weekends and holidays. So we're trying to get at that problem, and they do suggest an amendment in their testimony, and that is identical to the sponsor amendment that I have submitted. With that, I will just tell you that this legislation came to my attention because of Jakia Johnson, who's a grad student at Bowie State. So she's going to talk to you about the research she did. We're also joined today by 2 student leaders from College Park, Isha Yardy and Caroline Thorne. Just want to remind the members of the committee, in case you don't know, that this legislation is part of the Maryland Legislative Agenda for Women, which is a priority bill for 40 women's organizations across across the state. It's also a priority bill for the newly established Marylanders for Reproductive Choice Coalition. There are a couple of pieces of testimony in your packet that I'm going to point out because they're not testifying orally, and I want to just make sure the committee considers this. So first of all, I will tell you that there's testimony submitted from MCASA, Maryland Coalition Against Sexual Assault, and they remind us that unfortunately 1 in 5 women and 1 in 16 men are sexually assaulted during college, and also that 5% of rape victims of reproductive age become pregnant as a result of rape. So they make this a priority piece of legislation for them as well. Marylanders for Reproductive Choice notes that according to the National Library of Medicine, 61% of women who have children while enrolled in college drop out before earning a degree. And also the U.S. CDC reports that college-aged women account for nearly half of all STIs in this country. Another piece of testimony in your file is coming from a wonderful group called Medical Students for Choice, and they remind us that 50% of new STI infections are of the population 15 to 24. And also, unfortunately, the University of Maryland's zip code has the state's highest rate of chlamydia. They go on to point out that 5 of Maryland's public higher ed institutions currently do not have their own independent reproductive health centers, and 4 out of these 5 do not have a Planned Parenthood less than 50 miles from their campus. So we're trying to address a real problem here, and I think this bill gets at what we need to do. With that, I will close by saying, again, at the discretion of the committee, and I will defer to my colleague here, in addition to the sponsor amendment requested by the university systems, there's actually a list of co-sponsors who would like to be added. If you guys should I defer to the committee on that? I know we don't usually do that, but we did collect those as there were a lot of our colleagues who were interested in signing on. With that, I will pass it to my colleague, Delegate Smith, and see if she has anything to add before we hear from our students.
I'll be brief because, as always, Delegate Kelly's very comprehensive. I just wanted to lift up that what was really important about this bill was making a compromise and acknowledging the varied services that our public institutions can provide. Some have connections to entire hospitals, and some don't even have a medical home on campus. So what this bill does recognize is that despite the gulf and services that are available, there are certain things that can, through a plan, be thoughtfully included, no matter the scale of your public institution. So I'm really proud of this work product having been responsive to kind of the varied needs, the various setups, and then also listening to the advocates, and particularly the young people that are currently enrolled in college right now, to ensure that what we're proposing isn't just something that we think is good, that we think will work, but that people that are currently enrolled in higher education say that they need. So I'm very honored to be here with what might be probably one of your last, public appearances as a delegate, and happy to work and serve with you on this bill.
And just one more thing I forgot to add, which is after the panel of students, we do have some clinicians coming up. So if you have clinical questions, you can ask the next folks. And with that, Jakia,
Thank you. Good afternoon, Mr. Chair, members of the committee. As Delegate Kelly said, my name is Jakia Johnson, and I am a graduate student at Bowie State University. And this bill for me began as a research project, and my goal was to figure out how we could expand access to emergency contraception on Bowie State's campus. So I began my research by trying to figure out what resources we had available on campus, and unfortunately, there were very few. I reached out to our campus health organization, I'm sorry, not campus health organization, but I reached out to our student health center, and for all reproductive health issues, they refer us to what they call the Healthy Teen Center, which is located about a 30-minute drive from campus. And if you don't have access to a personal vehicle, it's over an hour and 40 minutes via public transportation. I found this very interesting, and I thought, surely this can't be the case across the state. So I took some time to look into what other campuses offer as far as reproductive health services go. And it was very clear that access to reproductive health was inconsistent across the state, which is unacceptable. We understand that college-age women drop out of college due to unintended pregnancy as one of the leading causes of dropping out of college. We understand that STDs and STIs run rampant on college campuses. We know that emergency contraception is effective and should be offered on college campuses, yet we don't have a consistent policy across the state that addresses that issue. And so my next step was to figure out if this is something that college students want on campuses. So I did a survey of college students We found that 84.3% said that 24/7 access to emergency contraception would be helpful on campus. 96% of the students I surveyed agreed that universities should provide education information on sexual health and contraception methods. And when we asked what barriers hindered their access to reproductive health care, almost all students unanimously agreed that cost, transportation, and limited health center hours were the greatest barriers to access. So all that research led me to where we are here today, and I urge you to please give a favorable report on HB 477.
Good afternoon, everyone. My name is Isha Yardi, and I'm the Student Government Association's Director for Health and Wellness at the University of Maryland, and I'm also a member of the Student Health Advisory Committee in our university's health center. In spring of 2021, our student government committed $16,000 to a free emergency contraceptive program, which gave students access to free Plan B upon request from the health center pharmacy and our dining services over a 2-year period. Since the program's soft launch, over 5,500 units of Plan B have been distributed to students across campus. The success of this program demonstrates an urgent need for universities to invest in the reproductive health of their students and how accessible reproductive resources should be inextricably linked to the already robust physical services that universities provide their students. This should go well beyond Plan B, which is only used as a time-sensitive medication, to include other forms of reproductive care, including birth control and referrals to outside providers. So last June, as many of you all know, Roe v. Wade was overturned by the Supreme Court, which has had significant impacts on the landscape of general reproductive care. Since the landmark decision, we've seen the prices of Plan B almost double, which has been difficult for us to keep up with our free EC program, and we've also witnessed a national increase in the demand for birth control. University health centers and colleges in general are crucial pillars of knowledge and support for students, many of who are living away from home for the first time. House Bill 477 ensures that universities are committed to providing comprehensive reproductive health care, which is integral to the holistic well-being and health of students on campus. I respectfully request a favorable report on House Bill 477. Thank you.
Hi, everybody. My name is Caroline Thorne, and I serve as the Director of Government Affairs for the University of Maryland in College Park's Student Government Association. I think that Isha really encapsulated a lot of what I wanted to say. But really, lack of access to reproductive health care is an issue which distinctly impacts college students. At UMD, we're very fortunate to have this access to free emergency contraceptives, but this certainly is not the case across all USM institutions. And we believe that this should be available. Having access to reproductive health care, including contraceptives, birth control, and accurate information on preventing STDs and unwanted pregnancies is really essential to ensuring students' well-being on campus. This bill is important because it requires institutions to either provide this health care or create that in-depth referral plan with those wraparound services. This includes transportation, which is one of the factors cited by the NIH as preventing college students from accessing these important services. Additionally, these plans would be created in consultation with students, which increases their motivation and engagement with reproductive health on campus. Thank you for your time, and I respectfully request a favorable vote on House Bill 477.
Other questions? Delegate Henson.
Thank you, Mr. Chairman, and thank you to the sponsors of the bill for bringing the bill. I think this is one of those areas where women's health care has, because the needs of women can be different and unique to women, that sometimes it doesn't get the full attention that it deserves. My question is about the delivery of other services, like counseling people on all the different things that we've worked really hard as a General Assembly to expand access to, like childcare scholarships, making sure that people are eligible for certain benefits, whether it's TANF benefits, SNAP benefits, prenatal care, prenatal vitamins, all those different things that we've worked really hard to make sure that the state has more robust resources. Do we know what our institutions are doing now to deliver that information to students that may be inquiring?
Thank you for that question, and it reminds me of something I wanted to address in my introduction to the bill, so I love the opportunity. You have a letter in your file from the Catholic Conference sort of mentioning exactly this and suggesting that pregnant and parenting services be included. I just want to note for the committee that that bill is being heard next, and that excellent sponsor, Delegate Healy, is, I think, here. So that's a great bill, too.
If for some reason it was an inclination to maybe just make one pass of this on the floor, would you all consider provisions like that a friendly inclusion into this bill, or do you see them as separate and unique?
As I said, I'm deferring to Chairman Smith on this. So.
Yeah, I have no problem with that. Sorry, just let me.
Thank you very much. And I also wanted to commend Ms. Johnson, Ms. Yardy, and Ms. Thorne on their testimony. And if I had any other questions, it would be to ask Ms. Johnson where I could find that suit, but I will defer.
Hello.
Thank you, Mr. Chairman.
She did that.
Thank you, Mr. Chair, and thank you all for bringing this bill. Very important. Appreciate all of the folks providing testimony, and to Ms. Chiquia Johnson for just doing yeoman's work that sort of served as the foundation for this legislation. And I'm curious, along the lines of Delegate Henson's questions around prenatal and parenting, whether as part of the survey, did you get any feedback from some folks on the provision of, prenatal, but also support for parents that are matriculating through college? Was there any data out there? Did you get any feedback on that? Just curious.
Thank you for that question. I actually did not collect any data on students who are pregnant or parenting, but it's an interesting question. I think it's worth looking into. The purpose of my research was to figure out options for students who are not interested in parenting. I'm a parent. I go to school. I'm a parent, and I do both, and it's not an easy thing. And I feel like it's a decision that people should be able to make on their own. And so this legislation is to focus on students who choose not to go through with parenting.
Thank you so very much for that. And Delegate Kelly, prefer to be your first favorite committee as opposed to your second. But thank you, Mr. Chair. Appreciate that.
We're just curious what judicial proceedings is on your list. Delegate Riley has a question.
Thank you, Mr. Chair, and thank you for our sponsors. In the fiscal note, it talks about that this could be very costly to some of our colleges, and specifically to those universities on the Eastern Shore, which I'm part of that delegation. It says that the actual costs to those universities could be possibly like a 200-mile round trip. How is the bill going to address that, or is that still staying in the bill, or how do you suppose that they pay for that additional cost?
Thank you for that question, Delegate Riley. So there should be no additional cost. Again, if you read in the fiscal note, it says that it contemplates that they have to provide a plan. Right. Part of that plan, and again, this information is all going to be available through that consultation with MDH if a university chooses to go that route for developing their plan. The Baltimore Abortion Fund and the DC Abortion Fund are nonprofit organizations that provide those wraparound services. So that could be folded into the plan. That would cost $0 for the school. What they would do is similar to what the Howard County Health Department does in their family planning services. They have a flyer and they say, this is the phone number for the service that will provide those wraparound services should you need them.
So once if the bill is passed, then each one of the universities and colleges would come up with their own plan, figure that out ahead of time, and be able to have that information available to the student.
Exactly, and also you'll note that this does require, the legislation as it's introduced requires that plan be updated annually. One of the reasons for that is because, as you know, serving on the Healthcare Committee, one of the things we're trying to do is strengthen our network of reproductive health care providers. So particular to Frostburg, I know that we have information on a new reproductive health services provider who's looking to open up in Allegheny County. So we want to make sure that those local resources across the state are available and that the schools are in touch with them to update their referral networks, which we think will be very, very helpful as we work on strengthening our healthcare workforce across the state.
Okay, and just one, can I have one more thought? Thank you, Mr. Chair. So basically, as I read through this bill and looking through some of the opposition, just so you can verify, so in this plan that the colleges and the universities come up with, is there going to be any type of information in that plan to say, hey, if you don't want an abortion, then we can take you to this location? Or is it just strictly for possibly the ending of a life?
No, it's for reproductive health care services. So it's not, again, there is another piece of legislation behind us for parenting-related services, and I'm very hopeful that you all will consider passing that. Similar to Ms. Johnson, I wasn't a parent as a student, but I grew up as a child of student parents, and that space is incredibly important, and we want the university systems, this is my opinion, I don't want to speak for everyone at the panel, but I think that it's really important that the university systems be extraordinarily comprehensive in the work they're doing to support parenting students, and it's more detailed than the level of work required for this plan, which should be easy and free to do, basically.
Okay, thank you very much.
Thank you, Mr. Chairman. Yeah, whenever we talk about abortion, obviously it's a very controversial topic. In fact, I do my very best with my friends and family to not even bring the topic up oftentimes. But so we were talking about the next bill is going to be about parenting, and generally that will be after the birth of the child. Is there anything in this bill that will address counseling for adoption options or anything of that sort to help save the life of that child? Because there's a lot of families out there that are trying to adopt.
So I think the best panel to answer your question is going to be the next panel, which is the clinical experts. They can tell you about what the process is in terms of if someone is seeking services, where and how that counseling works. This legislation is not requiring the university health centers to provide any of these services. So we wouldn't add into the legislation that they're required to provide counseling services in addition, because they're just doing referral services to healthcare providers who already do that type of work as part of their standard of care. So I guess the answer to your question is yes, and in that they're required to provide or refer for the full range of reproductive health care services. At that time, counseling does take place. But I would also say that I believe, and I don't want to, you guys are going to hear the bill hearing, but I think a lot of that conversation is embedded in the next bill. The other thing I would say to just be cautious of is that, and again, this is from my own personal experience, the research and the work that I've done, what we don't want to do is, and I would say the Department of Health would agree with me, Maryland state policy in general does not refer to crisis pregnancy centers because they often provide inaccurate health information. So when we're talking about, not all of them, there, some facilities that provide parenting supports are extraordinary and wonderful, and some are providing inaccurate health information. So I'm not going to be the arbiter of that, and certainly not with this legislation, but it's something to keep note of as we consider policy, and that's why I wanted to stay far away from that space.
No, I understand, but when we also talk about end of life, we do our very best to make sure that we let that person completely understand that it's a permanent decision. There are consequences to every decision, especially a decision that important. And I'm hoping that when we pass legislation like this, that we're going to provide that sort of counseling and have those folks really understand the seriousness of their decisions. Yeah.
I just wanted to mention that abortion care providers that would be recipients of referrals, in the provision of those services, they do provide that counseling about the suite of options available. So it's part of their standard of care as abortion care providers is to provide a full consultation and, about everything available. So I just want to make that clear.
And we will have some clinicians on the next panel. We can talk about it. Let's see any other questions. I just want to, again, thank Delegate Kelly and Delegate Smith for your leadership in bringing us this bill, and particularly our students, Jakia, Isha, and Caroline, and lending your powerful voices to this, clearly powerful voices. So thanks for being with us. We'll turn to our next panel. Michelle Seary, Pam Casemeyer, Shirley Rivers, and Jan Krebs rounds out our favorables.
I'll start. My name is Jan Krebs. I am a midwife with 40 years of experience in women's health care, and I'm speaking in favor of this bill strongly on behalf of the Maryland ACNM. But I want to start with one really basic thing. I understand your concern about abortion, but really, if we enact this, we're going to enable people who might have to make a really difficult choice not to have to make it, because all sexual and reproductive health counseling starts with, what would you like to know? And here are all your options, well before we get to the discussion of, you're pregnant, what shall we do? And I want to remind everybody about that because it's an important concept. What we're talking about is giving people the choice about whether or not they think about pregnancy. I do want to make a few policy points, and one of them is that Maryland recognizes access to reproductive and sexual health care as a right for all citizens, including minors. And at the federal level, Healthy People 2030 tells us that information about and access to effective contraception is an indicator of population health that's not moving towards better information, better access nationally. Now, I happen to know that issues about privacy and other concerns frequently are at the front of young women's minds, because I lost count a long time ago of the young women who would look at me and say, is this going to show up on my parents' health care bill? Because they were coming for treatment of a benign vaginal infection or for information about contraception and making choices about sexual activity. Additionally, we know that there are racial disparities in access to contraception, treatment for infection, and other aspects of care all across the country, including in Maryland. And that accessibility of care varies with where you are, how much it costs, and what patients can know.
If you don't mind just wrapping up.
Okay. Students away from home feel less confident frequently. So students on campus need this access, and significantly 24-hour access to contraceptive options, which include condoms as well as emergency contraception, contributes to patient privacy. And I want to make a point about Bowie State because I live in the community right there.
And then you really have to wrap up, though.
But I
2
am.
minutes for witness.
Bowie State is 3.3 miles from the closest pharmacy and probably 6 miles from the closest referral center. And that's in an area that we consider developed.
Thank you.
Students need care.
Welcome.
Good morning. I am Shirley Rivers from Baltimore City Health Department. I'm the program coordinator for the Youth Sexual Health Initiative, and I'm testifying in favor of this bill. I like to say that students enter college from various backgrounds, some straight from high school, and these students have a high need for reproductive health services. Many of these students have low levels of reproductive knowledge, and access to these services can affect the student's ability to be successful in their college education. There's always been a great discrepancy between young people's desire to avoid pregnancy and their knowledge to inability to actually be successful at avoiding pregnancy. This bill will prevent a unique opportunity for students to not only share information about reproductive health services, but to also set a tone on their campuses, in their classroom, and amongst their peers that reproductive health services is essential to continual success. Access to quality health care and sexual health education can have a far-reaching implication during college and beyond. For example, STIs are especially dangerous during pregnancy, and our congenital syphilis rates have increased over the past 10 years. As a matter of fact, in 2020, the rates were up 2,035% since 2016. And without access to testing and treatment, college students are at risk for several adverse sexual and reproductive health outcomes. Research suggests that college students are considerably higher at a considerably higher rate to experience sexual assault and partner violence, and this fact alone increases the need for access to reproductive health services. And on behalf of Baltimore City Administration, we humbly request a favorable report on this bill. Thank you.
Hello, Mr. Chairman, members of the committee. I'm Pam Casemeyer. I'm here on behalf of the Maryland section of the American College of Obstetricians and Gynecologists, respectfully, and very excited to be here to support this bill. You've heard a lot. I will try to just supplement a few little points that I've heard along the way to maybe put some context to what this is. First of all, ACOG is very supportive of this bill because it's an interesting approach. It requires the schools to work with the students to put this plan together. And when you think about it, college-age students, some of you, not all of you, may have been there at one time yourselves or have family or students or children who are there now. It's an odd time. They don't always share things even with their friends. They may be afraid of something. This is just not for women, it's men too. In the college setting, there's a lot of uncertainty, and if you're out of state or not in a community where you know where anything is, it's even harder to know what to do. So this really has the schools work with the students to put a plan together for a comprehensive range of either services or referral sources. So then when that student has a question or a concern or a need, the school is able to help provide them that information and resources. Yes, abortion is one component part of this, and pregnancy, but the range of issues that arise under sexual health is much broader, and this is an excellent approach to make sure that those college students can focus on their education, get their other issues resolved or addressed, or feel comfortable being able to access them in a way that's put together in a very comprehensive plan. So we strongly encourage passage of this legislation, and thank those for bringing it to it, and for the students were great. So thank you.
Thank you, Mr. Chairman. First, I'm sorry I missed in the first panel the ability to thank the bill sponsors for sharing this important bill. And my question is to you, Ms. Casemeyer, please. We heard a lot of questions earlier about options counseling, and I was wondering if you can elaborate a little bit about what your providers are doing currently when a patient comes to them.
I mean, it is the standard of care to be able to, whether it's in reproductive health or any type of healthcare issue, the standard of care is to educate the patients on their range of options, what those implications are, what they want to do, ask the patients what their desire is or inclination. That is the standard of care, whether it be for reproductive health or other services. So when whether it's whoever, be a provider under a certain circumstance, they may walk in and say, this is what I want, but even then the provider should usually talk them through and question them and ask them and let them know what their options are. And that really is what the standard of care for clinical practice is.
Thank you, Mr. Chairman, and thank you to the panel for your testimony. My question is for Ms. Krebs. I want to understand the benefits, if any, of getting access to early prenatal care. Can you help us understand what if any, benefits are there?
Absolutely, and I would hope that between this bill and the next bill that I'm not as familiar with, we'd be able to cover that. Because when someone comes into an office and they are pregnant, we need to understand where they are, and we need to get them into care as quickly as possible. Because the sooner you begin care, the better the chance of a healthy outcome. And we know that. The sooner a young student, and I've had lots of students in my practice over the years, the sooner a student can get into care, the better we can help them facilitate what they need in order to succeed both at parenting and at school.
Thank you.
Yeah.
Don't see any other questions. Thank you all for being with us. I'll turn to the honorable testimony, Eileen Roberts and Laura Bogley.
Good afternoon, Chairman Barnes, Vice Chairman Chang, and members of the committee. I'm Laura Bogley, Executive Director of Maryland Right to Life. I thank you for the opportunity to speak today in opposition to House Bill 477. Parents send their daughters to college for an education, not for an abortion. But this bill is an unfunded mandate on Maryland colleges to actively participate in predatory abortion practices using existing taxpayer funding. The bill provides no conscience clause to protect private or faith-based colleges, faculty, and staff who do not want to participate in abortion violence. We support any policy that supports pregnant students in continuing both their pregnancy and their education, but this bill creates a legal framework to position the abortion industry to prey on vulnerable young women without offering them medically accurate information, quality care, or life-saving alternatives to abortion. Planned Parenthood is in the business of selling abortions, not providing prenatal care. Less than 14% of their facilities provide any prenatal care at all. They already are entrenched on most college campuses, including Christian campuses, but this bill will subsidize their operations with additional public funding. This is despite the fact that 60% of people polled in a 2023 Marist poll are opposed to public funding for abortion. Influenced by radical abortion activists within the state legislature, the state of Maryland, including the Department of Education, Department of Health, have become state sponsors of the abortion industry, using taxpayer funds to contract out educational curriculum development, programs, training, and health care services to questionable third-party organizations that are financially interested in unplanned pregnancies and abortion sales, including Planned Parenthood and Advocates for Youth. We're capable of supporting pregnant students on campus without supporting federal Title IX and abortion.
Just wrap up.
For these reasons, we ask you to issue an unfavorable report on this bill. Thank you.
Hello. Good afternoon. Thank you for having me. My name is Eileen Roberts. I'm the founder and president of Parents for Life. Since 1987, Parents for Life has served as a collective voice for parents, educating the public and state legislators of the needs for public policy that protects our children and the right of their parents. Most importantly, however, I am the mother of a daughter who became severely depressed. Believing her boyfriend had introduced her to drugs, her father and I searched for answers. But instead of drugs, we discovered a follow-up questionnaire she hid under her pillow, which she never returned to the abortion clinic. While in the hospital for follow-up care for depression, it was discovered that her legal abortion was done incomplete, and she required follow-up surgery to repair the damage done by the abortionist. But she couldn't have that surgery unless I signed a consent form for the repair. But the rights denied for a life and death surgical abortion, I did not have a right to do. To add insult to injury, my husband and I were responsible for the follow-up costs of surgery and care for her depression amounting to over $27,000 under our insurance policy. I am not naive to know that there are daughters and children from abusive homes. But what we're doing in this country is we're giving our daughters secret abortions, and we're sending them home to the abuser to be abused again and again. These violations towards our daughters should be reported and are against the law. With the incredible increase in sex trafficking, online predators present in school, and of course social media, it is important more than ever. I am here today to oppose HB 477 because Maryland parents deserve better. This bill denies parental involvement and treats parents as a mere afterthought, or even worse, as enemies to the education process. If this committee really wants to help our children, the committee should involve parents, not ignore them out of the process. And in conclusion, you can help parents of Maryland by standing with them and oppose HB 477. And when you do so, you will restore family rights and protect our daughters. Thank you.
Any questions for this panel? That concludes the bill hearing on House Bill 477. We'll now turn to House Bill 356. Delegate Healy.
Thank you, Mr. Chairman, Mr. Vice Chairman, members of the committee. For the record, I am Delegate Ann Healy, here to present House Bill 356. This is a bill that codifies in Maryland law the benefits of the federal Title IX protections for pregnant and parenting students in higher education. The bill passed this committee unanimously by a 21-0 vote, and in the House 132-1 last year, but it did not receive a vote in the Senate. So I'm hoping that we can get this moving early and get it through the Senate. It's a crucial next step in ensuring that parenting and pregnant students do not lose their educational opportunities because of discriminatory institutional practices, and in the event that the federal law might be weakened. The bill does several things. It prevents higher education institutions from forcing pregnant students to withdraw or limit their studies. It requires the institution to allow pregnant students to take a leave of absence of no less than 12 months unless the student requests a shorter period. For non-birth parents of newborns, leave would be no less than 1 month unless student requests shorter time or a medical extension if needed, if medically necessary. It also requires higher education institutions to publicize on the institution's website the rights of pregnant and parenting students and to make reasonable accommodations for pregnant students. Reasonable accommodations include allowing students to make up tests and assignments if missed for pregnancy-related reasons and allowing medical excused absence. While Title IX does a lot of good already, and it is the law, codifying at the state level will ensure that these rights do not disappear if the federal law is weakened. And this follows on a similar bill that passed in California in 2019. I'm going to also provide a few background information that was provided by some of the supporters of this bill. In Maryland, most colleges do not list Title IX rights of pregnant and parenting students on their website. But there are 55,000 student parents in Maryland. That's nearly 1/5 of all undergraduates. And they would benefit from knowing their rights. They are more likely to drop out of college without these supports, and they might drop out just because they don't know their rights. Just 8% of single mother undergraduates will earn an AA or a BA within 6 years of college enrollment, compared with 49% of non-mothers. 80% of Maryland public universities do not offer childcare on campus, and more than half provide no specific lactation spaces for breastfeeding mothers. And, you know, these lactating spaces should not be in a bathroom or closet. That shouldn't count. So federal law already requires this. What this bill does is it guarantees that if the federal law should be weakened, Maryland will still have these protections for our students who are parenting or pregnant. And I'm happy to answer any questions.
Of the bill sponsor. Delegate Henson.
Thank you, Mr. Chairman, and thank you, Delegate, for bringing the bill. We had a bill hearing prior to this, and this bill was lifted up highly in that hearing. I want to make sure I understand how they overlap or how they don't. Would this bill have any provisions for requiring that there's counseling on the range of options when a person is pregnant?
That would be in the other bill. I think these bills are complementary. It's not an either or, it's a both and. There's a whole range of things that are needed. But this bill really doesn't change anything. It just says there's a safety net in case the federal law changes. And it goes a little bit further in allowing people to know what their rights are. So, because, as you know, if you're starting out in college and you get pregnant by surprise, and you don't know what your rights are, you may be forced into making decisions that you don't want to make about your education, about your health, about what you're going to do with your family, all of those things. Where if you know your rights, this is higher education. An educated student can be a free student to make good decisions for themselves.
I just wanted to make sure I was clear in understanding what features were offered in this bill. So it's more of a civil rights protection and publicizing that information so that students understand the range of rights that are available to them. Am I
Correct.
understanding that correct?
That is correct. Thank you.
Okay, and then if those rights are codified in state law, it also would give them the ability to seek enforcement and assistance here in the states or in Maryland if they had those rights available to them under state law as well. Is that right?
That is correct.
Okay. And then I wanted to make sure that I had another question for you, if you can answer it. We heard some testimony in the prior bill with uplifting your bill that talked about the standard of care that is required from doctors and from different providers, and that standard of care would have the effect of making sure that rights and options people were counseled on that. Do you feel like, notwithstanding that standard of care, that your bill is still important to make sure that these specific rights are made known to the students?
Absolutely. I think they should be known ahead of time when you're looking to go to college, just to know what your rights are as you go onto a campus. There will be other witnesses behind me from the medical profession as well who are supporting this bill. The standard of care for medical is one thing. Some people may not even get to that point. They may decide that they don't know what to do and they just stop going to class. And so, yeah, they should know ahead of time.
Thank you, Delegate. Thank you, Mr. Chair.
Acknowledge that that this bill is really redundant because Title IX does exactly what you.
I would say it's not redundant. I think, as the other delegates have said, it reinforces and it's a safety net in case the federal government does not continue these protections. And because what this bill does that goes further is to make sure that the students know what their rights are and that they have access to the supports that they need on campus.
So up until the point where these campuses have to disclose what these specific rights are, it is basically in line with Title IX.
It is what Title IX currently is.
That's
yes.
correct. Okay. So are there any talks with any of our colleges, or I'm sorry, is there any discussion in Washington now where they may weaken Title IX in any way? Are you aware of?
I am not aware, but in the last few years, a lot of things that we thought were rock solid in federal law have come into question. Okay. And so I think it's a good idea for the things that we really care about as civil rights to make sure that they're in state law as well. It doesn't hurt.
Okay, one more follow-up question, if I may. So have we surveyed our colleges and campuses across the state to know specifically how many or which colleges are not disclosing this information?
It's not a matter of not disclosing, because I think they're not hiding the information. It's that they're not putting it out there in a way that is easily accessible and really easy to find for students. I don't think anybody is failing to disclose. It's just a matter of making it available in a format that on the website that people can find it quickly.
Thank you, Mr. Chair. I just have a quick question. The opposition from the Maryland Right to Life is basically, however this bill would create a public framework and a potential public funding for the abortion industry, empowering them to prey on college students without the knowledge or consent of parents. Could you respond to that comment?
I don't understand that line of reasoning. It doesn't make any sense to me. I'm sorry. I wish to be respectful of their position, but I just don't understand where that comes from. Because this is already current law. It doesn't create anything except that you let people know what their rights are.
So just a follow-up, Delegate Healy, is that, in other words, let's say a young athlete, Title IX, got pregnant. Basically, they're going to realize that they don't have to have an abortion to be able to stay in school and to have the child.
And they can even keep their scholarship. Yeah,
Right.
that is a protection that's already in law. People don't necessarily know about it. And so part of what this bill will do is help people in the Maryland schools, at least to know what their rights are, so that if they are faced with a situation like that, they know that they don't have to end their career.
Okay, thank you, Delegate Healy. Thank you, Mr. Chair.
Let's see any other questions. Thank you, Delegate.
Thank you, Mr. Chairman.
See you
Committee.
soon. I think we do have a number of witnesses on this bill. Adhiti Valatharosu, Christine Crome, and Meghna Chandaraskar on. Welcome. Sorry if I mispronounced any of that. Whoever wants to begin can begin.
Good afternoon, Chairman Barnes, Vice Chair Chang, and members of the House Appropriations Committee. My name is Christine Crone, and I'm here on behalf of the Maryland section of the American College of Obstetricians and Gynecologists. I won't be redundant. Delegate Healy covered a lot of my points. I'm just here to say, as the organization who represents the providers that would care for the students, the pregnant students, we fully support House Bill 356.
Hello, Chair Barnes, Vice Chair Chang, and the members of the House Appropriations Committee. My name is Meghna Chandrasekharan, and I am the Government Affairs Director for the University System of Maryland Student Councils. On behalf of USMSC, I am submitting this testimony requesting a favorable with amendments report on House Bill 356. The USMSC represents all types of students, from first-generation undergraduate college students to parents who are pursuing a graduate degree. We believe that a student's gender identity, marital status, age, and personal beliefs and choices should not matter when it comes to reaching ideal accessibility in the USM. House Bill 356 takes the right step towards public institutions to promote accessibility for all students in the system. However, it lacks much clarity and definition currently as a policy. We believe that the policy must have more specific guidelines and must mandate every institution to have a parental leave policy. Students should not be forced to choose between their education and their personal family life. All public institutions should prioritize the wellness of students first and foremost. We believe that House Bill 356 would benefit the student body more if clear guidelines are established detailing what a pregnant and parenting student policy must include in accordance with Title IX and requiring all institutions to have a policy set in place. The amendments we are putting forth are to clarify the language of this bill and clearly define what the institutions must include in their policies for pregnant and parenting students. The language in the current bill is very vague and leaves room for misinterpretation. This bill must be reworded so it specifically addresses what must be included in these policies in accordance with Title IX. In summary, House Bill 356 protects the well-being of all students within the USM system by ensuring that they have policies set in place if they are pregnant or parenting students. We hope that the members of this committee recognize the value of this bill to our students, and we respectfully request a favorable with amendments report on this bill.
Good afternoon, members of the committee. My name is Aditi Valatharosu, and as Director of the Sexual Misconduct Prevention at University of Maryland Student Government Association, and as Director of the Title IX Advisory Board, I'm well versed in the functions of the Title IX office and students' knowledge of the office's policies. Through my positions and conversations with the greater student body, I can attest that many students are unaware of the protections they are afforded under Title IX. Pregnant and parenting individuals are already faced with significant stress. If subject to discrimination or harassment, which is highly probable considering historic discrimination against pregnant and parenting individuals, these individuals need not face additional stress in locating their rights. House Bill 356 would simplify the process of helping pregnant and parenting individuals in locating their rights by requiring that public institutions ensure that their policy is consistent with Title IX regulations, and that the policy is included on the institution's website. If these individuals feel they have been denied equal treatment and equal opportunity based on their pregnancy and parental status, the institution's policy would logically be the first thing the individual consults. Individuals who are unaware of their Title IX protections should not be disadvantaged in seeking support and exploring their rights. The institution has an obligation to provide students with the full extent of their policies. Pregnant and parenting individuals should have equal access to understanding their rights at their institution as individuals facing other forms of discrimination and harassment. I respectfully request a favorable vote on House Bill 356. Thank you so much.
Thank you all for being with us, and again, particularly our students who did a great job here. Thanks for your voice. I think that concludes the bill hearing on House Bill. Oh, I'm sorry, we apologize. We have an unfavorable Maryland right to life is with us again. Laura is here.
Thank you again, Mr. Chair, members of the committee. Again, Laura Bogley, Maryland Right to Life. We're hearing a lot of rhetoric about inclusive policies. I can assure you, there are no pro-life voices, representatives, or participation in any state programs. That is incorrect. These girls are not being referred out for prenatal care, and they're being referred to Planned Parenthood through these colleges, who's entrenched on most of these colleges. And Planned Parenthood is not a provider of prenatal care or adoption services. So they're being sent to an abortion mill to sell them abortions. And this is a predatory practice, and this is what we're opposed to. We're capable of supporting pregnant students on campus without adopting federal Title IX of the Education Amendments of 1972. Since 1975, the regulations attached to Title IX have required abortion accommodation by federal institutions. While some argue the regulation is neutral on abortion, in application, the rule has been used to justify the use of public funds to coordinate abortion services on campuses nationwide. The Biden administration has further weaponized Title IX against women and families by redefining woman and expanding the reach of the abortion industry at colleges and universities. This assembly is under no obligation to codify federal Title IX. You're under no legal obligation to fund the $2 billion abortion industry that does not need or deserve public funding. You do not have an obligation to provide, you do have an obligation to provide a quality academic education for all students and to ensure a safe learning environment for students on Maryland campuses. Finally, you have an obligation to provide for the health and welfare, and you should put pregnant students before these radical abortion policies by issuing an unfavorable report on this insidious bill. I'm happy to take questions. Thank you.
Sure. I'm kind of curious, though, given the conversation we had on the prior bill and this one. Just wondering, did you talk at all to the bill's sponsor?
Did I talk to Delegate Healy?
Correct.
I have spoken to Delegate Healy, and we have testified on this, on the codification of federal Title IX several times before. I've also talked to co-sponsors on this bill.
So the aims of her bill, as I understand from her own words, is focused on making sure there are appropriate services for pregnant and parenting students. So I think, on that part, are there no components of her bill that you want to amend to support, or just against the entire idea of supporting pregnant and parenting students?
Maryland Right to Life is opposed, Delegate, to the codification of Title IX in any of our state institutions. We can provide for the needs of pregnant students better by getting abortion bias out of our programs and giving women real choice.
I understand that, but if you look at the bill on page 2, it says that each public institution of higher education shall adopt a policy related to pregnant and parenting students. That is consistent with Title IX, but if you have an opinion that is not consistent with it and would add some clarification, it seems to me that then you would offer those to her as ideas on how to support that, correct?
We support programs like Students for Life, Standing With Her program, which provides all of the protections in law in the policy without codifying Title IX. Now remember, Title IX is abortion. It's a federal abortion mandate, Delegate. So if you codify Title IX, you're then rolling out the red carpet for an abortion framework. And I remind you, taxpayers are opposed to public funding for abortion.
I understand that that's your view. I'm not talking about Title IX. I'm talking about specifically about resources for pregnant and parenting students, which is the point of her bill. So, like, Title IX aside, are there any ideas that you guys have to actually support pregnant and parenting students in higher education? Because I think that's what Delegate Healy is getting towards.
So what your question is, Delegate, whether or not we support any other life-saving alternatives to abortion? Absolutely. We support any program that makes it easier for pregnant students to continue their education or succeed in their careers. But we don't believe it's an either-or choice. We believe that women are perfectly capable of completing their education and having their children and raising their children. And we work with a network of providers that provide that support. And contrary to the testimony that you heard earlier today, medical pregnancy centers in Maryland give excellent care. They give a wider range of services for pregnant women than abortion clinics, and they do it at no cost to women.
Well, hopefully we can agree that pregnant and parenting students need appropriate support, and I hope you will work with Delegate Healy to offer solutions separate from Title IX. Thank you.
Thank you, Delegate. Any other questions? Delegate McComas?
Just briefly, wouldn't it be possible that, okay, you want to preserve Title IX so the kids don't realize know that they're not going to lose their scholarship? Because it seems to me that if they were going to lose their scholarship, that would push them more into the, I got to get an abortion. Whereas if they know that they have, that they can keep the child and they can stay in school and they can keep their scholarship, that's really vital and important to them. So is there any amendments that could be put on this bill by Delegate Healy that would basically shore up your concerns, but because what Delegate Healy is offering is very important for those students to know, and basically saying, you know, if the person decides to keep the child, the school has to provide supports for that.
Yeah.
So
Delegate,
anyway,
Delegate, thank you for your question. A Hyde-style amendment that would prohibit the commitment of public funds for abortion providers, training, curriculum, all of that, on the previous bill would be relevant, and I would support that. But it would not be helpful on a bill that codifies Title IX because, of course, this is a federal regulation, and the state doesn't have control over the changes, including the Biden administration's recent expansion, which actually undermines women's sports program by redefining the definition of woman to allow biological men to compete in women's sports and for women's scholarships as well. So what we say is you can absolutely introduce a standalone bill, a clean bill that protects women both in sports, in academics, and in pregnancy without codifying federal Title IX, and we would ask that you do that.
Any other questions? All right, that concludes the bill hearing on House Bill 356. We'll move to House Bill 375. I think Delegate Rogers and Delegate Holmes are with us. Welcome. Great to see you all.
Thank you, Chair Barnes, Vice Chair Chang, and members of the mighty Appropriations Committee. I'm Delegate Mike Rogers for the record, and I respectfully request a favorable report of House Bill 372. In the 2006 legislative session, both chambers unanimously passed legislation that created the Veterans of Afghanistan and Iraq Conflict Scholarship. Under the legislation, veterans of the conflicts, active duty members of the armed forces who served in Afghanistan and Iraq, and members of the Reserve or Maryland National Guard who were activated as a result of the conflict are eligible for the scholarship, as are their spouses and children. Among those who served in these conflicts are former Senator Douglas J.J. Peters. Peters was a captain in the United States Army Reserves from 1988 to 1998 and served in Operation Desert Storm. His actions during Operation Desert Storm earned him the Bronze Star Medal. The Bronze Star Medal is the United States Armed Forces decoration awarded to members of the United States Armed Forces for either heroic achievement, heroic service, meritorious achievement, or meritorious service in a combat zone. Following his military service, he began life in public service. He was a Bowie City councilman from 1998 to 2002, then served as a Prince George's County Council member from 2002 to 2006. He was elected to the Maryland Senate in 2006 and served there until his retirement in 2021. Senator Peters is currently a member of the University System of Maryland Board of Regents. Peters also continues as an active member of the Bowie, American Legion, and Veterans of Foreign War Posts, and is a past commander. House Bill 372 will alter the name of the Veterans of Afghanistan and Iraq Conflict Scholarship to the Douglas J.J. Peters Veterans of Afghanistan and Iraq Conflict Scholarship. By adding Senator Peters' name to this scholarship, we will honor the years of service that he has given and continues to give to our state and to our country. I respectfully request a favorable report for House Bill 372.
Thank you. Delegate Holmes, did you want to add anything?
Thank you, Mr. Chair and members of the mighty Appropriations Committee. How are you? For the record, my name is Delegate Marvin Holmes, and I am here primarily just to ask for two things, Mr. Chair. The number one thing I'm asking for, Mr. Chair, if you would please add me as a co-sponsor to this bill. And the second reason I'm here is to please make sure that this bill does, in fact, get approved. JJ, we call him JJ. JJ is a good friend of mine. As indicated by Delegate Rogers, he was a county council person, a city council person for the city of Bowie, and he was in the state senate here for a good while. He and I are members of the same American Legion post, 66 in Bowie, and though he served in the Afghanistan arena, I'm a little bit longer in the tooth, Mr. Chair, and I got drafted during the Vietnam era. So he is a well-respected individual within our community. And I'm just asking for support for House Bill 372 in honor of JJ, if you don't mind, Mr. Chair, and to add me as a co-sponsor. Thank you so very much.
Great friend, great senator. So thanks for being here, Delegate Holmes. We appreciate you. Are there questions for this panel? All right, no witnesses, so that concludes the bill hearing. Thank you all.
Thank you to the mighty.
Thank you, Mr. Chair.
All right, thank you.
Mighty approach.
That helps. Yeah. All right, we'll turn now to House Bill 384, Delegate Smith. And Delegate, if you have a panel, or if not, it's fine, whatever you're...
I think there might be one other person. Yeah, there you go.
Great.
Good afternoon, Mr. Chair, Mr. Vice Chair, members of the mighty, august, and esteemed Appropriations Committee. I'm here to present to you House Bill 384, and this is a bill that many of us may have heard last year that was brought at that time by Senator Kramer. I am now on the House cross-file to that bill. And the reason why we brought this bill is that for years, it has been a policy of colleges, both public and private, to use the withholding of a transcript as a tool to coerce a student who is unable to pay a student debt. This bill focuses exclusively on how we can encourage institutions of higher education to utilize different systems and to stop using the withholding of transcripts. Now, there's a few reasons why I personally believe that this is an unproductive practice. One, we are increasingly seeing students that are first generation, like myself, matriculate at institutions of higher learning, and as such, they have a different level of, they have a more precarious financial reality. And to withhold a transcript that they've earned could prohibit their ability to engage in more social mobility, obtain employment, sometimes transfer, if necessary, to another institution of higher learning, and then also if there is a need to attain more higher education, the lack of the transcript could be a prohibition. So I personally think that this policy is not only distasteful, I do have some support and acknowledgement from the state Attorney General's office, their Office of Consumer Protection, their division, that they believe that it's important to remember that this is not the only way that an institution of higher learning can recover student debt. And most expressly, they note that the practice itself may be legally questionable because academic institutions are not secured creditors and do not have the right to withhold promised goods or services as a method of debt collection. Now, you may be wondering, can institutions of higher learning recover debt in other traditional ways, utilizing third-party debt collectors and the like? The answer is yes. But I believe that the withholding of a transcript goes beyond what is, I believe, appropriate and what the State Attorney General's office deems legally questionable. And there are many other states that have come to the same conclusion that the withholding of transcripts are not only, unsound practice, but against the best interests of the entities seeking to recover a debt. Most expressly, the states that have adopted this similar law include California, Colorado, Illinois, Maine, Minnesota, New York, and Washington. I want to note that you're going to hear from those who have concerns about this legislation a couple of different arguments. And I think many of them they revolve around this is what they have been accustomed to utilizing. And so what I would like to express to you colleagues is that we're here to ensure that the things that we're doing aren't simply the things that we've been doing, but they're the best ways that we can conduct business as a state. And so I strongly encourage you to give careful consideration to the passage of House Bill 384, because one, the best way to get a student who's unable to pay a debt is to put them in the financial position to do so. And also I want to note that there may be expressions of different strategies to accommodate the student that's unable to pay, and there may be an insistence that we carve out certain types of students that are more worthy of having accommodation. And I believe that that is I think that's not the best tactic. And what I want to say most expressly is every student that is in need will not be a Pell Grant recipient. As we know from other bills that we've heard here, if you earn $1 more that makes you eligible for a Pell Grant, you're not all of a sudden wealthy. So I just want to make sure that any exclusions or recommendations to amend this bill, if they are going in that direction, I find that to be unproductive and also inconsistent with what was stated by the Attorney General's office, is that the practice itself is legally questionable, not only legally questionable for people of a certain socioeconomic status. So with no further statements from me, I want to give the opportunity for those who also support the legislation and oppose it to have their say. And I do hope that you give careful consideration to House Bill 384, and that's the conclusion of my presentation. Thank you to my colleagues.
Thank you all for the opportunity again to testify today. My name is Caroline Thorne, and I serve as the Director of Government Affairs for the University of Maryland and College Park Student Government Association. And on behalf of the SGA, I would respectfully request a favorable report of this bill, which would end the practice of transcript withholding in Maryland. As the delegate said, former students need these transcripts to continue their education. They often serve as conditions for employment or even just to gain an occupational license. Transcript holding is really just counterintuitive to what the goal is. It prevents former students from getting a job, furthering their education, which are steps that they really need to take to pay off their debt. Outside of just repaying that debt, it also prevents these individuals from partaking in our local economy to the fullest extent that they could. According to the Consumer Financial Protection Bureau, there's over 6.5 million people in the United States who've had their transcripts withheld, with higher shares of lower income, Black, Hispanic, and Indigenous students victim to this practice. Transcript withholding disproportionately impacts these vulnerable populations and holds them back from employment and these further educational opportunities. I respectfully request a favorable report on this bill. Thank you.
For the panel. Thank you so much. Thanks again for being with us. We have another in-person favorable, Grayson Wiggins.
Good afternoon, Mr. Chair, members of the committee. Grayson Wiggins here on behalf of the United Way of Central Maryland, which has identified this bill as a priority bill for support this session. I think we can all agree that education is critical to the fight for equity and economic mobility. And whether it's for employment or for transfer purposes, access to the transcript is a critical piece of the education puzzle. Unfortunately, as Delegate Smith noted, debt often gets in the way, and it's important to note that that debt is not always tuition debt. So according to the Attorney General's letter of support, 64% of the people who have limited access to a transcript due to debt owe less than $25. You're going to hear from some of the schools about how this is a case-by-case decision. I just want to point out, we have an email here. It's from the University of Maryland, Baltimore. It is a mass email that was sent out and addressed to, quote, "Dear UMB student," and it says, "Currently you have an outstanding balance with UMB that will need to be paid prior to being permitted to register or obtaining your transcript or diploma." It previously states that the student in question received tuition remission benefits, which did not cover registration fees or graduation fees. So that's some important language, right? So that says to me that this mass email, this debt collection email that was sent out, pertains not to tuition, but to registration fees or graduation fees, meaning that the university may not even be certain itself, and that they have made a blanket statement that unless you pay that, or you're going to need to pay it prior to being permitted to register or obtaining your transcript or diploma, Really quickly, Mr. Chair, I question the need to withhold the transcript as a debt collection mechanism when, according to the University of Maryland Global Campus's website, after 90 days, the debt can be referred to central collections and a 17% penalty can be imposed upon the debt. And so with that, I would just request a favorable report and be happy to take any questions.
Thank you. Are there any questions? Okay, thanks for being with us. All right, we have a number of virtual witnesses. Julie, if you want to start getting them online, we'll start with Winston Berkman Breen.
All right, Chair. Can you hear and see me?
Yes, we can. Welcome.
All right, thank you so much. So my name is Winston Berkman Breen. I'm Policy Counsel with the Student Borrower Protection Center. We're a national policy organization focused on student debt in Maryland and across the country. And I'm testifying today on behalf of the SBPC in support of HB 384. So I've written and submitted written testimony that cites to several reports, and I want to sort of +1 to all the testimony before me, so I'll just hit some additional highlights. So this bill is, at the end of the day, all about letting students succeed, especially low-income students. Without your transcript, you can't, finish your education, sit for licensing exams, get a job. And really what transcript holding does is put students in a catch-22 that helps no one. As a student, you need to get a job to earn the money to repay your debts before you can get your transcript, but you need your transcript to get the job and earn the money, right? So transcript withholding was the norm, as the delegate said, until a few years ago, but rapidly schools and states and the federal government are changing this practice. So several schools are already voluntarily ending transcript withholding. Just last month, the University of Oregon announced it would stop withholding. So clearly it can't be so critical to their operations. And more states are prohibiting it, and the delegate listed several of the states in recent years. You also heard that the Federal Consumer Financial Protection Bureau calls this practice abusive. And just before that happened, the U.S. Secretary of Education called on schools to rethink withholding policies because of its detrimental effect on retention and completion for students. So we also want to add that withholding disproportionately harms low-income students and Black and Brown students. A report from the state of Virginia last 2 months ago at this point, last year, on its public institutions found that Black and Brown and low-income students were disproportionately in debt to their schools relative to their enrollment population. And finally, I just want to note that we know it causes harm, but we actually haven't heard any compelling evidence. We're seeing reports about its efficacy as a debt collection tool. If you can't pay, you just can't pay. And that is that. Unlike with a mortgage or a car loan where you can take possession of a property and sell it to recoup your losses, the transcript has no value, right? Its only goal is to inflict enough pain or discomfort on the student to force them to pay. So letting students get their transcript quickly is the best way to put them in a financially secure position and have them repay their debts.
Thank you.
Final, I'll just note that this isn't a cancellation bill, right? So the responsibility is still there. It's just about putting people in a position to repay their debts when they can. And thank you. I'd be happy to answer any questions.
Are there any questions? Winston, I don't see any questions. Thanks for being with us.
Thank you.
I'm going to turn to Melissa Dudley.
Hello.
Hi, Melissa. We can hear you. We can't see you, but we can hear you. So if you want to give your testimony.
Okay, give me 1 second.
You do need to turn your camera on. There we go.
Hi, everybody. Thank you so much. I apologize for that.
You're here, ready to go.
So good afternoon, Chairman Barnes and Vice Chairman Chang and members of the Appropriation Committee. I do appreciate you guys for allowing me to have this opportunity to share my personal testimony in front of you today. So my name is Melissa Dudley, and earning a college degree is extremely important to me because I would be the first generation of my family, as my parents don't have their degree. Also to pretty much be an example to my 2 daughters, and as a single mother to essentially obtain a higher paying job within my career because most jobs were requiring a undergraduate degree. So in 2014, I transferred from CCBC to University of Baltimore. I began in the summer on a transfer scholarship as well. A year later, so I then got ill and I had to withdraw. And so it was after the grace period, so essentially it left me with a bill. So I was told by the bursar's office at University of Baltimore that I could not attend any more classes during that time until I paid my bill off, which obviously I didn't have a $500 monthly amount to pay because that was the amount that they said could be the repayment agreement. So needless to say, it left me with a bill I couldn't pay. I couldn't return back to school. I couldn't transfer because I needed my transcript. And so essentially, it kind of put me in limbo. So it's affected me greatly because, again, I wanted to go back to school, but clearly even during a repayment plan, they wouldn't allow me to. And then when I had the idea of maybe transferring to like Phoenix University that was online, that wasn't even an option because I couldn't get my transcript. So it's also prevented employment opportunities because some of these places were even willing to consider the fact that I was short of getting my degree, but they wanted to see the classes that I took. But I couldn't get a transcript from University of Baltimore because of the unpaid balance, or just having a balance due.
Right. Well, thank you so much for sharing your story today.
You're welcome.
With us. Are there any questions for Ms. Dudley? I don't see any. Thanks again for being with us.
Thank you so much. And just so you guys know that this has also impacted my daughter, and she'll be providing her testimony as well. So this is a multi-generational issue that it should be addressed.
We will look forward to that. We have a couple other virtual witnesses, so we'll go to Jade Jackson.
Great. Thank you so much again for the opportunity. Have a great
Okay, let's go to our last virtual witness, and we'll try Jade one last time before we finish up. Priandria Franklin. Okay. Not responsive. Okay, we're going to try Jay Jackson one more time, and if she's not responsive, we'll move forward with the other witnesses who are here. Okay, and to our virtual witnesses who are not responsive, if you're watching this later, we will accept your written testimony.
Can you guys hear me at all?
Oh, we can, but we don't have. You have
I
to turn your
can't hear
camera on.
you at all.
All right, you're going to have to turn your camera on, Jade.
My audio is up, but I can't hear.
All right, we're going to, if you can't hear us, we're going to go ahead and disconnect here, but we're going to, when you watch this later, we're going to accept any written testimony you might have. Okay. We do have two favorable with amendment, Patrick Hogan and Meghna Chandraskaran. Welcome.
Good afternoon, Mr. Chair, Mr. Vice Chair, members of the committee. Thank you for the opportunity to testify on House Bill 384. For the record, I'm Patrick Hogan for the University System of Maryland. You should have a written testimony, so I'll just hit a few of the key points from that. Our USM institutions work closely with students experiencing financial struggles to ensure that they are able to continue and complete their studies. Our campus financial aid specialists and student affairs staff work on an individual basis with students who have debts with the institutions because they don't want them to end up in collections. And they really do try to resolve these issues with students as evidenced by our low default rates. For those students without the ability to pay, requests for transcript releases are reviewed on a case-by-case basis and are typically released for purposes of employment. Also, the campuses work with students to set up payment plans so they don't necessarily need to pay off all of the debt immediately in order to receive their transcript. The likely impact of restricting this practice is more outstanding debt with the institution that eventually is transferred to the central collection unit. That is not good for the institution and is not good for the student. The USM is working on amendment suggestions, including amendment to set a dollar amount threshold by which our institutions can continue to use this tool to assist in collecting delinquent debt. When the Senate passed the bill last year, they added that amendment to the bill, and we would seek that again this year. And with that, I'll stop and just say that the USM looks forward to working with the sponsor and with the committee on potential amendments to this bill. We are favorable with amendments. Thank you.
Right. Hello again, Chair Barnes, Vice Chair Chang, and members of the House Appropriations Committee. Again, my name is Meghna Chandrasekhar, and I'm the Government Affairs Director for the University System of Maryland Student Councils. And I'm here today on behalf of the USMSC to request a favorable with amendments report on House Bill 384. We believe that obtaining access to a college transcript is paramount in ensuring that students can benefit most from their education post-graduation, and that it is a matter of equity. The practice of withholding transcripts from students who often can't afford to pay off their debt disproportionately affects both students of color and students from low-income backgrounds. It is widely recognized that student loan debt and the racial and socioeconomic wealth gap are self-reinforcing. In order to finance higher education, Black and marginalized families already disadvantaged by generational wealth disparities are burdened more by student debt than white families are on average. The additional risk minority and low-income students face when taking on student loans are exacerbated by other disparities in the higher education system, including predatory for-profit colleges. With lower family wealth and racial and socioeconomic discrimination in the job market, students of color and of low-income background are far more likely than white students to experience negative financial events after graduating, including loan default. Taken together, this means that while many marginalized families currently need to rely on student loans to access a college degree and its resulting benefits, the disproportionate burden of student debt perpetuates inequality and inequity in our state. This bill allows for higher education to be more equitable for all students, but we do understand that there is a financial aspect to consider. We also recognize that ensuring that students fully pay their owed tuition is important to the financial stability of the institution. For that, we would like to propose a payment plan to be implemented for students to pay back their debt. This requires further discussion, and we are ready to have that discussion with you. However, I would like to still acknowledge that there are multiple options available for institutions to consider. In summary, HB 384 allows for students to receive their transcripts so they can use it for any situation if needed, while also addressing the issues of financial stability of the institution through the inclusion of the amendments. We as USMSC are ready to work with the sponsors for these amendments, and yeah, all right, thank you.
Testimony. Are there any questions? I think Delegate Acevedo, did you have a question?
Yes, thank you, Mr. Chair. I wanted to go back to Mr. Hogan's testimony where mentioned that, in most instances, they do allow the transcripts to be released for employment, right? Did I get that correct?
Typically, that's the case, yes.
When are the instances where they're not released if it's for employment purposes? What circumstances would constitute a no?
Honestly, Delegate, I would have to ask our institutions that what because again, they take it on a case-by-case basis. I don't know what would trigger them to withhold it in that situation.
And I would also imagine that every institution that's within USM has a form of collections or collection agency that they would refer debt to.
Because the State Central Collection Unit.
Correct. So if there is a tool for collecting delinquent debt, right, and we know the disproportionate impact that this one particular tool, withholding transcript, has, not just on all students, but a particular group of students, why argue to keep that tool in the toolbox?
So it is one of the tools that our institutions use, again, on a case-by-case basis. The debt that goes to central collections, we are not always recouped for that debt. I think it's a pretty small percentage that we end up getting back. So our institutions want to keep this as a tool for above a certain amount. When the larger debts are owed, we want to be able to still use this as a tool.
And what's that amount?
Last year, the Senate adopted $1,000. I believe it's $1,000. So this bill would apply to debts under $1,000.
And
And how many students or how many folks would fall within that?
So we collected some information from our institutions, and it's cited in the fiscal note. I think the institution that gave the most information was University of Maryland College Park, and I believe, let me see if I have the numbers here. So for 2022, they had a little over 2,300 students with an unpaid balance of $1,000 or less, totaling $440,000. And then there were 750 students with an unpaid balance of $1,000 or more, which totaled $15 million. So the fewer number of students have the bigger amount of debt. So the $1,000 or less would capture the majority of the students in this situation.
So, and one more question, Mr. Chair. So you currently have that practice in place where you withhold transcripts, and you have, from what it sounds, millions, right?
That's one institution. It's more than that when you count the other institutions. There are 12 institutions in the system. And the policy is, the system-wide policy allows for this. It's a may, it's not a shall, and then so it's up to the discretion of the institutions. And as I said, they typically do it on a case-by-case basis.
I'd appreciate some information on what would that case by case or what would constitute that. I know you mentioned like sort of like a threshold in terms of the amount, but I think that'd be good information to have. But thank you, Mr.
We can get you
Chair.
additional information, Delegate.
Thank you.
Yeah, thank you.
So this is the third time it looks like this bill has been they've tried to pass this bill. So last year, I don't remember a cross-file on this side.
Yeah, it was not cross-filed last year.
So on the Senate side, did they accept all of your amendments, or just the one that you just referred to?
Now you're asking me to remember last session, Delegate. I think we had a couple of amendments last year. The one that I think the biggest amendment was the threshold amount of $1,000.
And did that bill move out of the Senate?
It did.
Okay, so we just didn't pass it on the House side. So if we accept your amendment, with the threshold of being $1,000 or more, where you can still use this as leverage. So in order to release those transcripts, do they just have to simply agree to a payment plan, or do they actually have to pay off that loan before you'll give them those transcripts?
Typically, if they enter into a payment plan, they're able to receive their transcript.
Okay, very good. Thank you.
Mr. Chair, you mentioned that only a small amount of the fees are typically recouped once they're sent to collections. Can you tell us, to your knowledge, why that is?
I do not know why that is. I mean, I guess we'd have to check with the central collection folks. I mean, I don't know, and I can check with our budget folks as well.
Okay, and once they're sent to collections, and obviously therefore it's in default, there's default interest that's added to the debt. Is that correct?
I am not an expert on debt interest, Delegate. Again, I would have to ask our budget folks.
Okay, and I just want to make sure we have an understanding of the tools in the tool belt that you have. Obviously, once the debt is sent to collections, it could then be pursued through litigation. Is that right? They could file suit to collect the debt?
I believe so.
And if they get a judgment, that would attach as a lien to any real property by operation of law. Is that right?
I'm sorry, say that last word.
If a judgment is obtained from that lawsuit, then a lien would attach to any real property owned by the individual by operation of law, correct?
I suppose so, Delegate. It sounds like you know it a lot better than I do.
I'll make it easy. It is correct, yeah. And in addition, once you get a judgment, you also have all of the post-judgment enforcement measures at your disposal, right? Such as garnishing somebody's wages, such as garnishing their property, levying their property. Is that right?
Again, all we're talking about here is transcript withholding. You know, that's the issue at hand. You know, there's typically not a whole lot of property involved, or real property involved. It's just that transcript.
Okay, I just want to make sure that we have a full understanding of all of the other tools in the tool belt if the transcript withholding is removed. So, thank you.
Thank you, Delegate.
Mr. Hogan, you mentioned the numbers of students and amount of money. Can you repeat that again?
Sure. And again, this is just for College Park, Delegate. There's some other fiscal note information. I think some of our other institutions provided some information as well. So just for 2022, 2,300, a little over 2,300 students with an unpaid balance of $1,000 or less, totaling $440,000. 750 students with an unpaid balance of more than $1,000, totaling a little over $15 million.
So we're talking about almost 16 million at College Park alone.
Correct.
Okay. And is that a 1 year? Is that how much is accumulated over 1 year? How old is some of this debt?
So that's 1 year. Sort of the combined information, the central collection unit portfolio included, and again, this is just for College Park, included more than 44,000 accounts with unpaid balances of $1,000 or less, totaling $6 million, and more than 9,900 accounts with an unpaid balance of more than $1,000, totaling $54 million. Again, I don't know how many years that's over, but that's the total portfolio at CCU for College Park.
So do you have any sense of how effective withholding transcripts are in actually recouping this debt? Because that sounds like a lot of outstanding money that goes unpaid and transcripts just aren't released.
According to the folks on our campuses, it is a tool that helps them collect debt, particularly for some of the, it's not always tuition, sometimes it's fees, things like that. So it's a tool that sometimes just acts as a reminder for the student that I owe this, and it triggers them to pay it and then really receive their transcript.
Okay, I'd love to see maybe some information, I don't know if you can gather it or not, about how much you guys recoup based on this tool versus some of the other tools.
I can try to gather some information from our campus.
That would be great, thank you.
Thank you.
You said the third time up, Mr. Hogan?
What's that?
Third time this bill's been put in?
I believe it's the second.
First time with Delegate Smith?
Correct.
So maybe talk to the bill sponsor and try and work with her.
Will do,
All
Chair.
right. Any other questions? That concludes the bill hearing. Thanks for being with us.
Thank you.
We'll now move to House Bill 428. Delegate Smith.
That's right. Hey, we're still together.
I know. Happier times with me and this guy. Thank you, Mr. Chair, Mr. Vice Chair, and members of the committee. I'm here to present to you House Bill 428. This is a bill that is about ensuring that our student members of the University of Maryland Board of Regents are able to participate and fulfill their duties without any undue burdens. As you know, of the 21 members of the Board of Regents, 2 are students. We have currently provided an opportunity for those students in their second year to be provided with some tuition support so that they're able to fulfill their duties without any financial burdens. And what this bill would do, with the generous contributions of a private donor, is ensure that those student board members are able to receive those tuition waivers for both years of their service. And so it's my delight to present House Bill 428 for your consideration, and I do hope that it will receive a favorable report. Thank you.
Thank you very much. My name is Dr. Joanne Boffman. I started as an associate professor back in 1982 in the School of Medicine, and after having several faculty and administrative positions for the last decade, I've served as the Senior Vice Chancellor for Academic Student Affairs, but I only have 14 days left in that service. The 2-year commitment that these students make is significant. Not only do they do all of the work that the other regents do, but they work on a weekly basis with the University System Student Council, and they attend meetings at every one of our campuses. Having mentored many of these students over the years, from my perspective, these outstanding student servant leaders deserve our support. From your perspective, this is really a technical amendment to a standing statute. But from the student perspective, this could be a real game changer. Students who don't have the resources might be able to, in fact, choose this as one of their areas to serve the institution. We are very thankful for Delegate Smith and her support of this, as well as Senator Sarah Elfreth, a former student regent, who has co-sponsored this on the Senate side. And we would greatly appreciate your support of this bill. Thank you.
Thank you, Mr. Chair. Again, for the record, Patrick Hogan with the University System of Maryland. I want to thank Delegate Smith for sponsoring this bill. We certainly appreciate it. And of course, I really want to thank my colleague and my friend, Dr. Joanne Boffman, who for the last 10 years, as you heard, has served as the USM Senior Vice Chancellor for Academic and Student Affairs. And she served in other roles within the system for many years before that, mentoring and supporting students for decades. As you heard, she is retiring at the end of this month, and she's made this generous donation to create this fund for student regents before she goes, which really is a fitting addition to her legacy of support for students. So we ask for your favorable report on this bill. Thank you.
Great. Thank you very much to the bill sponsor for presenting the bill, and thank you very much, Vice Chancellor Bachman, for your service and also your generosity, and Mr. Hogan. Are there any questions for the bill sponsor or the panel? Seeing none, that ends the bill here. House Bill 428. Next bill is House Bill 295. Delegate Henson, University System of Maryland Student Withdrawal, Reimbursement Tuition and Fees, the Cameron Carden Act of 2023. Delegate Hanson, please feel free to bring up anyone to your panel. Thanks.
Thank you, Mr. Chairman, and thank you for the opportunity, colleagues, to present this bill. This bill is a reintroduction. It was passed unanimously by this committee last session and passed unanimously on the floor as well on third reader. It did run out of time in the Senate before we did adjourn sine die. This bill would allow students to safely and efficiently withdraw from universities within Maryland's education system under certain extenuating circumstances that pose a threat to a student's physical or mental well-being. The way that the law is currently written, it's very clear that if students have a physical injury or harm, that they should be allowed to withdraw, and that's considered an extenuating circumstance. But when it comes to a mental injury, it is not very clear, and has had the interpretation in past times that students have not been able to recover tuition that's been paid out of pocket when the injury is mental and not physical. This bill is named after a young man, Cameron Carden. Cameron Carden was a student in one of our institutions, and after some incidences of racism that were experienced on campus, his mental health started to suffer. And his parents came and they noticed that mental health was declining for Cameron, but the consideration of whether or not to withdraw him from school soon became a financial consideration on Cameron and then his parents after they withdrew him so that he could recover, but realized they would not be reimbursed for the tuition that they paid out of pocket. So what this bill would do is it would correct that, and it would make it clear that mental injuries are also worthy of that support from our universities. You'll see written testimony included from the Student Government Association of the University of Maryland College Park, the Student Government Association at UMBC, and also from Mr. Cameron Carden, the bill's namesake, who was able to recover and is now thriving as a student at a different institution. Thank you, Mr. Chair.
Thank you very much, Delegate Henson, for presenting the bill. Are there any questions for the bill sponsor? Thank you. We have a witness today for this bill in favor. We have Doug Grice.
You had this bill in last year, and I think it was a unanimous vote in this committee, I believe, right?
That's correct, Delegate. Well, thank you for the question. I appreciate it.
All right. Thank you, Delegate Grice. We have today for a favorable testimony, Meghna Chandrasekhar. If you'd like to provide testimony.
Mr. Chair, I believe that she opted to submit written testimony.
Okay. Great. Thank you very much. That concludes the bill hearing for House Bill 295. The committee will now move on to House Bill 275. Delegate Foley, State Personnel, Collective Bargaining, Faculty, Part-Time Faculty, and Graduate Assistants. Delegate Foley, please proceed when you're ready.
Thank you, Mr. Chair. Mr. Chair and members of the Appropriations Committee, for the record, I'm Delegate Linda Foley, and I'm asking for a favorable report on HB 275, which extends collective bargaining rights to full-time and part-time faculty plus graduate assistants who work at the University System of Maryland, as well as Morgan State and St. Mary's College of Maryland. In the past, the House passed a bill extending collective bargaining rights to graduate assistants. This time, the bill also includes full-time and part-time faculty. You'll also recall that in 2021, the legislature voted to allow collective bargaining for academic workers at Maryland's community colleges. That law will fully take effect in 2024. There's no reason for faculty and other academic workers at Maryland's four-year public colleges and universities not to enjoy the same rights as their counterparts at community colleges. In fact, some part-time faculty at our community colleges also teach the same courses at our four-year schools. Meanwhile, graduate assistants in the UMD system have been advocating for the right to bargain for more than 22 years. It's past time to allow graduate assistants, most of whom earn far less than Maryland's livable wage, the right to bargain over wages, hours, and working conditions. Earlier this month, graduate assistants at Johns Hopkins University voted overwhelmingly, I think it was like 97%, for union representation. If collective bargaining rights are good enough for Johns Hopkins graduate assistants, they are good enough for UMD graduate assistants. Likewise, several Maryland private colleges and universities have collective bargaining rights for full-time or part-time faculty, including Goucher College, McDaniel College, the Maryland Institute of College of Art, and Johns Hopkins. Nationwide, 24 states have laws that allow faculty at four-year academic institutions to collectively bargain, including Delaware, Virginia, Pennsylvania, New Jersey, New York, and even Ohio. We are all aware of the increasing threat to higher education and the academic professions. Without collective bargaining at our UMD system, faculty members don't have the protections they need to freely teach the truth without concern of what political backlash will do to their academic freedom, their research, and their livelihoods. UMD administrators will likely tell you that there are already systems in place to address the concerns of faculty and grad assistants. But so-called shared governance bodies, such as faculty or university senates, or meet and confer procedures, are merely advisory and informative. They do not give academic workers a legal or binding mechanism to enforce any agreements or grievance resolutions. Only collective bargaining can do that. I've told you what this bill will do for academic workers at our public four-year colleges and universities. What it will not do is force them to join a union. Having collective bargaining rights merely gives workers the right to select a union to represent them. It doesn't mandate or dictate that any union be recognized, nor does the bill automatically impose a contract at the UMD system. Unionization will occur only if more than half of the workers in a bargaining unit officially sign cards indicating that they want a union to represent them. I'm sure every member of this committee, and in fact every one of us in the Maryland General Assembly, believes in democracy and fairness. Collective bargaining ensures democracy in the workplace, and democracy through collective bargaining ensures fairness in the workplace. That's all the faculty members and graduate assistants from throughout Maryland who are testifying here today are asking from you. That's all the more than 2,000 Marylanders who signed petitions in support of this bill are advocating for: democracy and fairness. Our new governor has inspired us with his call to leave no one behind. Thousands of workers at community colleges, private four-year schools, and on campuses all over our state have collective bargaining rights. Please don't leave our faculty and graduate assistants behind. Give HB 275 a favorable vote and help them achieve the same basic rights that the majority of workers in our higher education system already enjoy. Thank you, and thank you to the students and faculty members who are standing up for basic democratic rights at work. I'll be very happy to answer any of your questions.
Thank you very much, Delegate Foley, for presenting the bill. We have a question from Delegate Corbin.
Thank you, Mr. Chairman. Thank you, Delegate Foley, for bringing your quite loud and boisterous support to this piece of legislation. It's really important. You mentioned 24 states, I think, that have collective bargaining for higher ed faculty, thus dispelling any sky is falling rhetoric around the faculty. Do you have any info about other states on the grad assistant piece?
Yes, I think I do.
But suffice to say, Maryland wouldn't be
Yes.
the first state that would have
Absolutely
their...
not. I think for graduate assistants, it's even more. In those states, the 24 states, their collective bargaining rights for faculty, but I think it's very similar for graduate assistants.
So like the Massachusetts state system, the New Jersey state system, those all have...
Yeah, they all have the Massachusetts. I think some of the advocates who are testifying here today have more information on that, more specific information on that than I do. But yes, Massachusetts, places like Pennsylvania, New York, Ohio. I'm not sure about graduate assistants in Ohio, but there are other states where graduate assistants. Michigan is one where there are a lot of graduate assistants who have collective bargaining rights.
Thank you, Delegate. So plenty of other high-performing state institutions of higher education have these rights, and they're able to continue to perform at a high level.
Absolutely, yes.
Great. Thank you. Thanks for bringing the bill.
Thank you.
Mr. Chairman.
Thank you, Delegate Corman. Delegate Henson.
Delegate Foley, thank you for bringing the bill, and I also wanted to thank you for your interest in the committee's work. And you've been here for quite some time today, and you've been here and engaged and patient in the work of the committee, and I just wanted to thank you for that.
Oh, thank you, Delegate.
Thank you.
Appreciate it.
Thank you, Delegate Henson. Are there any other questions from members of the Appropriations Committee for the bill sponsor? Seeing none. This afternoon, we have several witnesses who are joining us in favor. If you can just come up to the panel, we appreciate it. We have Karin Rosenblatt, Jared Ball, Alberto Baca Jr., and Christopher Cano. Please come up, and each of you have 2 minutes. We appreciate it. Thank you.
Chairman Barnes, Vice Chair Chang, and members of the Appropriations Committee. I'm Karen Rosenblatt. I'm a professor of history on the College Park campus. I also sit on the National Council of the American Association of University Professors. You'll be hearing from almost all our public state institutions today, and you'll get plentiful testimony of unfair and frankly sad working conditions on our campuses. But what I want to talk about is the failure of shared governance, which is the #1 issue across Maryland higher education that I hear about when I talk to faculty. The ranks of overpaid higher ed administrators has become severely bloated. This month in hearings, USM leaders talked about their ability to, quote, run their business. Our universities are not businesses. They run instead on principles of shared governance. And those principles have historically produced excellence in research and teaching. Today, university senates are a charade. Faculty spend months developing curricula that administrators toss aside. And then faculty on temporary contracts fear losing their jobs if they speak up. When the people doing the teaching can't speak to their administrators, students lose out. University administrators are wrong when they assert that collective bargaining would undermine shared governance. Research suggests quite the opposite. And our university staff already bargains collectively and participates in shared governance. Collective bargaining will provide mechanisms for publicizing policies. It would put in place badly needed grievance procedures. And perhaps most important, it would create enforceable mechanisms for implementing policies. By curtailing individual discretion, it would favor and further equity. Members of the Appropriations Committee, university administrators have made their decisions over the past decades, and they have chosen to expand their own ranks and increase their own salaries. Now let faculty and graduate assistants choose.
Ms. Rosenblatt, next.
Oh, sorry. Greetings. Good afternoon. My name is Jared Ball, and I'm currently a tenured and full professor at Morgan State University. And I want to quickly summarize my emphatic support for HB 275, the human right of collective bargaining and unionization. In my more than 20 years of university teaching in Maryland, with 17 at Morgan State, I have suffered personally or witnessed firsthand my own work plagiarized and submitted for funding, an erasure of observable criteria for advancement or compensation, deans with bachelor's degrees running schools where in-field PhDs are removed for their having a desire for academic freedom, salaries of favored faculty bumped while the rest are told to forever wait for new studies to conclude women and senior faculty are underpaid, faculty openly referred to as terrorists for having been born outside the U.S., direct threats of abuse of power by administration, and an endless list of passive-aggressive hostilities. Teaching, learning, and research are all best served by faculty who are themselves supported, confident in their place, properly compensated, and who have the ability to collectively bargain to assure optimum experience for all involved. The quality of research diminishes when faculty are overworked and underpaid and have no voice to raise and no ability to make themselves heard. The quality of student experience is only enhanced when engaged by faculty who are not exhausted by their third or fourth class of the day, having to come from meetings where they are only threatened into doing more for fear of losing their job, or who have the ability to conduct research and teach in stress-free environments. No labor force should be without an ability to collectively bargain, and no one interested in the best results of that labor should stand in the way of this fundamental point. I am therefore in favor of HB 275 and the support for this long-held human right to collectively bargain. Thank you.
Good afternoon. I'm Tito Baca. I am the president of the Montgomery College chapter for full-time faculty at that institution. I'm here on behalf of those 500 members here to support our colleagues at these four-year institutions. We have the unique distinction of being the only collective bargaining chapter in the state of Maryland in higher education for full-time faculty. We have been organized for 40 years. So we know we make a difference, we know how we make a difference, and we know what happens when we can't be effective. This isn't just about salary, compensation packages, and benefits. It's about academic freedom, it's about job security, it's about equity. So we advocate not just for faculty, but we advocate for staff, we advocate for students, we advocate for the college, and that's because we have a healthy and collaborative relationship with management. We're not the union you see on TV, throwing bottles, picketing, striking. We work behind the scenes, we work in formal, embedded strategies in our contract that we use. We utilize these strategies to meet with management regularly, sometimes by text message on a Sunday. How can we solve this problem? What can we do to make things better across the college, and not just for, again, just for faculty? I'll give you an example. There was a faculty member who got a one-year fellowship to go to a school in Florida to finish the doctorate program in person. Full ride for that 1 year, tuition, everything. Dean said, no, you can't go. Didn't want full payment during that time away, just wanted to be able to go away for a year, finish the doctoral program, and come back. The union stepped in, advised senior management of what was going on, and senior management said, this doesn't make sense. We're saving money while he's away, paying part-time faculty. He's going to come back with a doctorate degree, going to make a difference, going to make a difference for the college. That faculty member was me over 20 years ago, and I'm still hoping to make a difference and contribute, and I hope I'm making a difference and contributing to four-year institutions. Thanks for your time.
Mr. Cano.
Yeah. Good afternoon, Chairman Barnes and the House Appropriations Committee members. My name is Christopher Cano. I'm the coordinator for member political engagement at SEIU Local 500, and I wish to thank Delegate Foley for her leadership on this issue before us today. Throughout this great state, tens of thousands of residents turn to the public universities as an affordable and effective way to start a new career, learn valuable skills, and begin a better life. The public universities are anchor institutions in many of the local communities here in Maryland, offering employment, education, and a path to economic empowerment. Sadly, for grad students and faculty, they remain the only state employees without the right to collectively bargain with their respective administrations. And that means that in virtually all decision-making, the professionals who are on the ground at local campuses and working directly with students have no real voice. As our faculty leaders will tell you, their working conditions are students' learning conditions. Their lack of a voice has had serious consequences for students, including loss of office hours and access to their instructors outside of class time. So as Maryland looks to recover from COVID, the universities will play a central role, and they will not only provide instruction to hardworking Marylanders, but as yet an unforeseen amount of professional retraining for workers who need a fresh start in this new economy. For so many Maryland workers, our universities are the lifeline that they need to recover. Faculty and staff are frontline workers at our universities, and they interact on a daily basis with students in the classroom, in the dining halls, and in the libraries of these institutions of higher learning. To create and maintain an environment in which scholarship and achievement of the student body happens, across the state, faculty and grad students are demanding that they receive the simple sign of respect in return, to have their voice in their own workplace through collective bargaining. SEIU Local 500 represents over 20,000 members, including many institutions of higher learning throughout the DMV, and I myself was an organizer on the ground to help push for collective bargaining rights for our community college faculty. I can tell you that the sky will not fall should you adopt this House bill, and we ask you for a favorable committee recommendation. Thank you for your time.
Thank you very much, Mr. Cano. Are there any questions from members of the Appropriations Committee for this panel? Seeing none, thank you everyone for being here. Call the next set of witnesses. Next, we'll have Todd Reynolds, Adam Schneider, Jan Michael Archer, and Zane Poffenberger. Each of you have 2 minutes. If you could introduce yourselves, and then please proceed, and please proceed as you wish.
Yes, good afternoon. Vice Chair Chang, members of the Appropriation Committee, happy Valentine's Day. My name is Todd Reynolds. I am the political coordinator for the AFT Maryland. AFT Maryland has submitted written testimony in support of this bill. In a previous life, though, I was a graduate assistant, well, former faculty, full-time faculty at Georgia Tech, and a graduate assistant at the University of Florida, where I was president of the Graduate Assistant Union. So I can answer some of the questions, and I know some other grads, too, that Delegate Gorman had. I wanted to at least spend some of my oral remarks talking about unionization is generally the norm for higher education in the country. We checked, and Delegate Foley did a great job pointing this out. Of the states that have send schools to the Big Ten, I think 9 of them allow collective bargaining for either full-time faculty, part-time faculty, or graduate assistants. In our region, that also includes Pennsylvania, Delaware, New Jersey, New York, Vermont, numerous others. It's kind of like we're an outlier. It's an outlier if you don't have this. I wanted to also mention, I think Delegate Foley pointed out, it's under the NLRB, recognizes at least graduate assistants as employees, and Hopkins just 2 weeks ago voted 97% to have unionization. And so that's important to note. We have it also for the community colleges in the state. Some of the same people you're going to be hearing from today are adjuncts at universities, as well as the community colleges teach the same course. In one instance, they at least have collective bargaining rights, and the other they don't. That doesn't make sense anymore. The current structure that they have in place is not enough. The university is going to try to tell you that shared governance is appropriate. Shared governance, what they mean by that is a faculty senate that's advisory, or a grad student government that's also advisory. At institutions that are unionized, and I'll finish up in just a second, they have both a faculty union, as Professor Baca just pointed out, and a faculty senate. So they work together. Alone, a faculty senate or grad student government is not enough. It's a new day in Maryland. We have a new governor really interested in rolling our sleeves up and fixing some of the problems that plague our institutions. We have faculty and grads who are interested in doing that. Let's give them a path to fix our institutions. Let's pass HB 275. Thank you.
Mr. Vice Chair, members of the committee, my name is Adam Schneider. Thank you for your time and attention this morning. I'm here in strong support and urge a favorable report of House Bill 275, which would advance the University System of Maryland's stated commitment to diversity, equity, and inclusion. I've worked on implicit and explicit curriculum at an institution within the University of Maryland system trying to advance diversity and equity and inclusion. And across the websites and on the walls of the institutions within the system, these words are everywhere. They all state that they're committed, and this is a concrete instantiation of that commitment, of those stated values. It is therefore surprising that the system and its institutions have opposed this legislation. Such opposition suggests that the depth of their commitment to these values and this vision is quite shallow. The systems in its schools encourage their members to come together around many experiences and identities, but want to continue to prohibit folks from coming together around their experiences as workers. And that's something we shouldn't allow. The system in its schools seem most comfortable only to include folks in meet and confer or advisory roles in which power is clearly inequitable. Its failures are demonstrated by the fact that there are so many people here today in support of this bill, and have been in the past. I urge a favorable report on House Bill 275 to help the University of Maryland system live up to its stated values and vision. They clearly need your help because they're not doing it themselves.
Esteemed delegates, my name is Jan Michael Archer. I am a graduate assistant at the University of Maryland College Park and president of Fearless Student Employees. Like many admitted graduate students, I was offered a 20-hour assistantship when I began my studies in fall 2018. In my first semester, I regularly worked 40-hour weeks, including nights, weekends, and holidays. When I expressed concern at this, my advisor said he too was overextended, but that the work just needed to get done. In my second semester, 40-hour weeks turned to 60-hour weeks. I confided in other professors in the department about being overwhelmed. Beyond a few extensions on my own assignments, nothing was done to support me. In my third semester, I discussed my still worsening working conditions with the department chair, who was well aware of this pattern of abuse due to fielding complaints from previous students of my advisor. Later, my advisor would scold me for going over his head. I can vividly remember my fear and panic in that moment. By the fourth semester, 2 other doctoral students, both women who had silently dealt with my advisor's sexist bullying and belittling of their labor, burned out and left the lab. And in my fifth semester, having contributed to dozens of grants, manuscripts, and presentations, I was on the verge of failing out myself. Worse yet, it was reinforced at virtually every level that this was my own fault. Seeing no way through another year of this toxic environment, but no way out without a black mark from my scorned advisor, I seriously considered ending my life. Upon joining a therapy group with other graduate assistants who were experiencing the same things, I felt for the first time that I was not the reason for my poor work environment. They empowered me to leave my advisor, a decision I made almost a year ago today. Esteemed members, I ask you, where does the buck stop? As our 300 written submitted testimonies show, my experience is not unique. What does it say about the current state of affairs at our public institutions when I must bring a workplace grievance to Annapolis to be heard? Collective bargaining rights will not rid our workplaces of bad supervisors, but these basic democratic rights will give strength to many of the most vulnerable and exploited workers in our state. Your vote in favor of passing this bill speaks truth to power. All Maryland workers deserve dignity, sanity, and voices in their workplaces. Thank you.
Good afternoon, Chair Barnes, Vice Chair Chang, and members of the Appropriations Committee. My name is Zane Poffenberger, a graduate assistant at UMBC, and I'm here to represent the UMBC Graduate Student Association and ask for a favorable report on HB 275. UMBC is a Tier 1 research university whose graduate assistants provide vital contributions to research and teaching, which highlights the status of higher education in Maryland. UMBC is a minority-serving institution, as more than 50% of students are people of color. UMBC has the second largest USM graduate workforce with over 750 GAs in research, teaching, and administration. According to a recent GA survey, more than half of our GAs are women and almost 40% are international students. This past fall, some were not paid for months, with no streamlined or timely way to report these issues. We need the option to unionize to ensure that we can negotiate and enforce formal and binding contract agreements that include adequate pay, benefits, and workplace conditions. 64 of survey respondents said that their stipend does not cover their living expenses. 2/3 of respondents are full-time master's students who receive the pay minimum of $1,733 per month. The monthly living wage for a single adult in Maryland is $3,063. More than 15% of the respondents also reported a responsibility for dependents, which is even more untenable on this salary, especially as we do not get subsidized dependent health insurance. The current process of meet and confer is meant to consist of formal discussions every semester between grad school leadership and the GA Advisory Committee. At UMBC, no such official meetings took place for 2 years until fall 2022. The mandatory report each university must submit to USM each semester provides no way for graduate students to directly articulate lingering concerns. We need the option of collective bargaining, and I ask for a favorable report on this bill. Thank you for your time.
Thank you very much. Thank you to all the witnesses for being here. Are there any questions from members of the Appropriations Committee for this panel? Thank you very much for being here. We'll call the next set of witnesses. Delegate Lewis.
Thank you, Mr. Chair. So my questions are for the graduate students having in a past life been a graduate student at University of Maryland's campus. I know your lived experience. I just want you to elaborate a little bit more on that power sharing and relationship with, I guess, your advisor or your manager. When you get a graduate assistantship, it covers some of your tuition, which you are dependent upon, I'm certain. what happens when, I think the first time that you stated that the hours increased to 40 hours beyond the 20 that was negotiated, did you feel like you had any power to change that dynamic?
No, none whatsoever.
And then when it increased to 60 or 80 hours?
No. At every point where I elevated my concerns, they were talked down or soothed away or shouted down in some cases.
And you said UMBC, do they have a Senate as well?
Yes, we have a similar process. We have a graduate assistant advisory committee, and that is a committee made up of graduate students that meet each semester with the grad school leadership to discuss issues. But again, those issues, there's no formal agreements. It's basically just a listening session, and nothing is enforceable.
Yeah, I just recall during my time there a similar experience managing students on behalf of faculty who you're interacting with and trying to guide while guaranteeing your own education experience. I think what's often forgot for graduate students in particular, a number of them are parents too. So, speaking to that cost of living piece, I don't know if you have any commentary for folks who are supporting families while they're also in graduate school. Can you elaborate on that at all? Or was that in your survey?
Yes, so the survey we had at UMBC, we had over 100 respondents, and 15% of them responded that they were responsible for dependents, and at that salary, it's untenable. It's not sufficient income, and also the insurance, the health insurance. At UMBC, for most departments, they will only pay for one individual. So if you would like to get extra coverage, you would have to pay that out-of-pocket expense.
Yeah, thank you guys for coming and testifying. I just think that, go ahead.
Sorry. I can add a little bit more on for our parental students. At the meet and confer, at the most recent meet and confer, we brought up the issue of parental leave. Graduate assistants only receive 6 weeks of parental leave. Faculty receive 12. The response that we received was that, well, that's good enough for other universities, and so it should be good enough for Maryland as well. But graduate assistant mothers and fathers are no less mothers and fathers than other faculty or other people. And so this is the dichotomy that we're dealing with.
Thank you so much.
Thank you, Delegate Lewis. Are there any other questions from members of the committee for this panel? Thank you very much, gentlemen. Next, we'll call up the next set of witnesses. We have Jaden Mikulinski, Donna Edwards, and Brian Whipple.
Good afternoon, Mr. Chair and members of the committee. Happy Valentine's Day. I'm Donna Edwards. I'm president of the Maryland State and DC AFL-CIO. I appreciate very much the work of this committee. I've been sitting in here a while. You've had a long day. The sponsor, Delegate Foley, did an excellent job of laying out this bill, as did all of the witnesses before. So all I want to ask is that you bring Maryland into the ranks of several other states that are allowing this to take place and letting the faculty, part-time faculty, and the graduate students exercise their freedom to express democracy and fairness. Thank you, and please give a favorable report to House Bill 275.
Good afternoon. My name is Jaden Mikulinski, and I'm a higher education graduate student at the University of Maryland College Park. I'm also a member of both the Graduate Student Government and the Fearless Student Employees organizations. I'm a first-year master's student who has already worked within 3 departments officially. This should be concerning, as my classmates are just beginning their secondary roles. Primarily, the nature of graduate assistant financial package has required me to take on overload positions alongside full-time study and a pre-existing full appointment assistantship. More importantly, however, a previous experience of mine working in another department on campus can be described as disheartening, unsafe, unethical, and hopeless. As someone who prides themselves on their ability to problem solve, face conflict, and endure, the lack of a formal grievance process for graduate student employees has made me feel hopeless for the first time in the workplace. When I imagined coming to the school in the great state of Maryland, I imagined a fresh start, unmatched possibilities, unwavering support, and a sense of established community. It truly saddens me to say that I've only experienced a fraction of these graduate school liberties, as have thousands of other graduate students at my campus. In filing complaints, I've been disregarded, given false promises, and told that they're just from another generation and another time. I've been told that things will get better, that my issues would be resolved collaboratively, but this is not the case. This complacency eats away at our university's core values and missions, and I am indeed no longer a fearless Terp. I should be able to walk into the workplace knowing that the undergraduate students I work with are safe from microaggressions, as well as hostile and unfounded biases and stereotypes, that my Ukrainian-American identity is protected and valued, or in the absence of these most basic requests, a unified, established, and legitimate grievance process exists. With collective bargaining, my trust in the state of Maryland will begin a rebuilding process. I can progress towards becoming the fearless Terp I once was, impassioned and prideful to be a state employee and a student at our flagship campus. So please protect your student constituents and the next generation of public servants with a favorable vote of House Bill 275. I thank you for your consideration.
Thank you very much, Ms. Malinsky, and also Ms. Edwards for being here. Are there any questions from members of the committee for the two gentleladies? Seeing none, thank you very much. We also have several virtual witnesses who are in favor. We have first Joan Bevilacqua. Good afternoon, Ms. Bevilacqua. Please proceed when you're ready. In 2 minutes.
Thank you. Chairman Barnes and House Appropriation Committee members, as a university adjunct professor for over 20 years, I would like to introduce myself and my colleagues. For those of you unaware, we are the ones left behind. We are the ones left. We are the only state employees who cannot collectively bargain with our administration for better working conditions, such as job security and compensation. We want to sit down at the bargaining table and speak for ourselves and our students. With the hard work of over 10 years, community college faculty finally won the right to collectively bargain because of the courage and will of those on this committee. How can the professors at the Maryland universities be left behind? We are not asking for handouts or special treatment. This legislation simply gives the faculty and grad students the right to decide for themselves if they want to form a union, not a mandate. We are the same professionals, whether at our community colleges or public universities. I, like thousands of other adjunct professors, teach both at our universities and our community colleges. But as of now, we have disparate faculty experiences. As a community college professor, I have the right to collectively bargain, but as a University of Maryland global campus professor, I do not have that right. Where is the fairness in this? The time for change is now. As our Governor Wes Moore has said, no one left gets left behind. I strongly urge you to vote yes on HB 0275 and call on the members to provide a favorable committee report. Thank you very much.
Thank you very much. Thank you for joining us virtually. Next, we have Benjamin Bradley. Thank you for being here, Mr. Bradley. Please proceed when you're ready.
Thank you, Vice Chairman, and to the whole Appropriations Committee. My name is Ben Bradley, and I'm a librarian at College Park. I'm here to ask the committee to provide a favorable report on HB 275. Every American by law has the right to collectively bargain, the right to have a voice at work, but Maryland state law explicitly denies that to the faculty, librarians, and graduate assistants. As a librarian, this is concerning as I've witnessed not only the divestment from the libraries, but the burnout among my colleagues. According to public data from UMD's Institutional Planning, Research, and Assessment, College Park has seen a lot of growth, with about 6,000 more students today than it did in 2001, and it offers 1,300 more courses. Yet, since 2001, the libraries have lost about 1/3 of its total personnel. There has been a 40% decline in the number of librarians at UMD, declining from 107 in 2001 to 57 in 2021, and then rebounding slightly to 63 last fall. This is a symptom not only of divestment, but of retention issues as well. Fewer and fewer folks are asked to do more and more and more. They burn out and leave. In turn, library services not only suffer in quality, but are cut entirely. For example, we are currently sunsetting a research data management application, which we had offered to campus researchers, but because the person who managed that left, it's being sunsetted. If we had collective bargaining rights, we could collaborate and resolve our concerns with leadership. But without those rights, we are unable to speak up to address these challenges in order to improve conditions for ourselves and to improve the services offered to students, faculty, researchers, and the state. Please rectify our exclusion by providing a favorable report for HB 275. Thank you.
Thank you very much. Next, we have Tom Goyens joining us virtually. Thank you very much for joining us. Please proceed when you're ready. 2 minutes.
Hi, yes. Esteemed delegates, greetings from the Eastern Shore. I speak as a faculty member of the Salisbury University and for Salisbury University's AAUP chapter in favor of this bill giving faculty a real voice. During the pandemic, faculty had little say over decisions made by administrators. For example, regarding the ability to work remotely or in person due to medical or childcare issues. Faculty were expected to quickly pivot from in-person to fully online learning, resulting in extensive retraining without additional compensation. Collective bargaining rights will help reduce salary compression and ensure that faculty receive a salary commensurate with their experience. New faculty are hired at current market rates, while existing faculty do not receive regular pay increases. This results in new faculty with little teaching experience making a salary similar to experienced faculty. A survey of our campus found that full-time, non-tenure track faculty feel like quote-unquote second-class citizens with inconsistent expectations for workload and confusion about benefits and rights. Part-time, contractual, and graduate assistants also hold tenuous positions. Since 2019, Salisbury University gives these adjuncts cost of living increases out of the university's budget based on quote-unquote gentleman's agreement, but not a contract. So also part-time faculty are employed based on class enrollment, which means their classes can be canceled at the last minute, leaving them without a job. If your course is canceled at last minute, you still have to do extensive preparation, and that remains uncompensated. And so finally, I believe a unionized faculty will be more effective advocates for student services, student well-being, and ultimately student achievement. So we request a favorable report on this bill. Thank you for listening.
Thank you very much, Mr. Goyens, for joining us virtually from Salisbury. Next, we have virtually joining us is Jeffrey Ogbar. Hi, Mr. Ogbar. Thanks for joining us. You have 2 minutes. Please proceed.
Thank you very much. It may be odd that I am speaking on an issue for Maryland from Connecticut. I am a professor at the University of Connecticut, and I am the president of the UConn, University of Connecticut, AAUP, American Association of University Professors. I arrived at UConn in 1997, and over the last 26 years or so, historian, not a mathematician, I've gotten a chance to see the application of collective bargaining, its utility, and the efficacy of organized labor. in action. We have been defenders of not just academic freedom, but also we've been advocates for working conditions, for making sure that the collegiality between faculty members and administration. We've been able to maintain so many different policies and enact policies to the benefit of the university itself. And along that line, the University of Connecticut has been able to recruit faculty members from across the country, knowing that the university supports a climate for intellectual inquiry, for protections of various sorts. And the university has, in fact, risen through the ranks as a consequence of our ability to attract the most competitive faculty members throughout the country and, in fact, the world. And this, I believe, is one of the most valuable policies and consequences, rather, of having a collective bargaining group and an organized labor at the university level. I know, again, that these are two different states, but I suspect the conditions are similar, and the fruits of these activities of recognizing collective bargaining would be similar.
Great. Thank you very much, Mr. Ogbar, for joining us from Connecticut. We appreciate it.
All right. Good luck. Thank you.
The testimonies coming from virtually that are favorable. Next, we will call up a panel of unfavorable testimonies. We have David Ownby, Allison Wren, Ellie Modlin, and Stephen Fetter. So thanks everyone for being here. 2 minutes, and please pursue when you're ready.
Thank you, Vice Chair Chang and members of the Appropriations Committee. I'm Dr. Allison Wren, the Senior Vice Chancellor for Academic and Student Affairs for the University System of Maryland. My testimony today will be focused on shared governance, which has been an integral part of higher education for 100 years and is a way of ensuring meaningful faculty and graduate student participation in institutional governance. This process is not just theoretical. The University System of Maryland produces an annual report on shared governance that emphasizes the importance of faculty involvement in personnel decisions, selection of administrators, preparation of the budget, and determination of educational policies. Shared governance within the USM is dynamic and nimble. As defined by the American Association of University Professors, shared governance refers to the joint responsibility of faculty, administrations, and governing boards to govern colleges and universities. Differences and the weight of each group's voice on a particular issue should be determined by the extent of its responsibility for and expertise on that issue. Each year, the USM Council on University System Faculty completes a survey of Senate chairs on the state of shared governance in the USM. Faculty are asked to determine which of 4 perspectives on shared governance closest meets what is occurring on the campus. I won't go over each perspective, but in last year's survey, nearly 70% selected shared governance as the obligation to consult. The remaining 30% selected shared governance as an open system of open communication. The follow-up comment suggested that movement to an open collaboration setting is generating momentum. Shared governance begins with the belief that the faculty and administration feel that they are partners in a shared project. One more sentence. This is what shared governance means. This doesn't imply there is agreement each time, but there is collegiality and respect. Thank you.
Thank you. I'm Steve Fetter, Dean of the Graduate School at College Park. In my written testimony, I note the progress we've made through Meet and Confer, which includes a 58% increase in minimum stipends over the last 5 years. The average stipend at College Park is now equivalent to $37 an hour. But I'd like to use this time to address the question I've been asked in past hearings: why shouldn't GAs have the same rights as employees? And the answer is because GAs are different from employees. When we hire faculty, we do a nationwide search to identify the most qualified candidate, and we offer a salary that reflects their training and experience and their performance. But we offer graduate assistantships only to full-time students, mostly to PhD applicants, to encourage them to accept our offer of admission. The assistantship is based entirely on their promise as a student. The GA stipend is not salary or wages. It's not compensation for work performed. It's financial assistance to cover the cost of the degree. That's why the stipend is exempt from payroll taxes and the tuition benefit is exempt from income taxes. The stipend doesn't depend on training, experience, or performance. All GAs in a unit receive the same stipend. An assistantship is part of a student's education. This is clear for research assistants who do research for their degree, research that is required regardless of whether or not they have a GA. Collective bargaining can have no bearing on the amount or quality of work necessary to earn a PhD, which is very challenging. That's why most universities with collective bargaining exclude research assistantships. But the connection to education is also clear for teaching assistants, even for those who won't go into faculty positions. Learning to explain complex concepts is essential for all researchers. My greatest concern is that collective bargaining would change the relationship from student and mentor to employee and supervisor, and that will negatively affect the educational experience. Thank you.
Good. Thank you, Chair, members of the committee, for your attention. I'm David Ownby, Professor of Chemistry and Associate Dean of Graduate Studies at Towson University. You have my written testimony, so I'll limit my remarks. TU is currently expanding its research and graduate student capacity. However, the majority of our assistants are master's students, and will continue to be master's students that will be with us for about 2 years. Even though they are with us for a short amount of time, it is important that faculty and student develop a professional mentoring relationship that would be limited by a more rigid employee-employer situation that unionization would impose on the building of trust and support between faculty and student. Graduate students are important members of the university community and are included as members of college and university level committees, including those that address university budget, curriculum, and student appeals. The Graduate Student Association president is an ex officio member of the Academic Senate and was appointed to the Presidential Search Committee. Graduate students play a great role in the leadership of the university across all of our shared governance bodies. In addition to their participation there, TU utilizes the meet and confer process to ensure that students' voice is heard by university leadership. And when I say university leadership, it's not just the graduate school, it's the provost, the VP for Administration and Finance, and the Chief HR Officer all attend those, as well as the graduate dean. In response to student concerns, additional staffing to the Counseling Center for Graduate Students has been added, and stipend increases of greater than 74% since spring of 2018 have occurred for the lowest paid master's level assistants, and an increase of greater than 40% for doctoral teaching and research assistants. Between the increase in stipend levels, adding additional assistantship positions, and higher tuition waiver costs, TU has increased its investment in our graduate assistants by approximately $1.1 million since spring of 2018. Overall, we have a strong working relationship with our graduate assistants, and thank you for your attention to my oral and written testimony.
Good afternoon. My name is Karen Olmstead. I have the pleasure of serving as Provost and Senior Vice President of Academic Affairs at Salisbury University, and I'm here to comment on the impact on faculty related to collective bargaining. I just want to mention that Salisbury University has a long-standing tradition of shared governance, and we maintain positive and collaborative relationships with various faculty, staff, and student-led organizations. We have shared governance consortia that has representation of all of those groups, and each of the heads of our 5 shared governance groups sit on the President's Advisory Team, which meets twice a month, and also on our Strategic Budgeting and Planning Committee, which meets monthly. I do have a concern that collective bargaining could be potentially highly disruptive to shared governance and also the well-established policies and procedures that we have on campus, as well as those at other USM institutions. I'd also like to comment on the potential concerns we have about compensation and benefits. One thing that's true across the system is our diversity of different campus types and the diversity of disciplines within each of our campuses, and the needs to compete effectively in the market for faculty that come from all those different disciplines, and we all work hard at that. Just a few other comments I would like to make in the few moments I have left here is that the faculty role is very complex. I think we all agree with that. There are more than 40 faculty types listed in the University System of Maryland Board of Regents policies. Managing that across all those faculty types, I think, would be very difficult, and then you add the disciplines to that. While Salisbury University serves Maryland as a regional public comprehensive institution, as a Marylander, I'm concerned about the impact of this legislation on the R&D in Maryland, given the lack of this type of given the lack of collective bargaining at AAUP organizations or institutions. And last, I'll just say that unionization could result, as others have commented, in adversarial relationships between faculty and campus leadership, administrative leadership, and distraction. I want to underscore that at a critical time in higher education when we're focusing on things like student preparation, enrollment, student and employee well-being, and the implementation of the Transfer with Success Act to support our community college partners and their students, and also the blueprint for Maryland's future. Thank you. I ask for an unfavorable report on this bill.
Thank you very much to the panel. We have a question from Delegate McComas.
Just briefly, they're kind of like a bit of a hodgepodge, but on the governance, do you provide like a climate survey that's anonymous, or from your teaching assistants or graduate students? Is it anonymous?
At Towson, it is.
At Maryland, it is anonymous.
Okay. And so is it kind of like a climate survey for them as well, so that, you know, you get a good sense that things are good or bad, or, you know, people are unhappy?
Yes.
So has those surveys or governance surveys or climate surveys, how would you say, 50% happy, or could you give us a percentage?
I would say on our last survey, it was well over 60 to 70% that were satisfied or highly satisfied with their student experience at Towson University.
Okay, and how often are those surveys conducted? Once a year?
Every 1 to 2 years.
Okay, all right. And then the other question I had was, you said that the average stipend is like $37 an hour. I think someone said.
At College Park.
That's at College Park.
So my question to you is, like, how many weeks is that? Is that 52 weeks yearly? So if you do the numbers, you can figure out, or is it 9 months? Or I just wondered how many months that would be for them.
We have 9-month appointments, 9.5-month appointments, and 12-month appointments.
Okay.
So all of our teaching assistants have to have 9.5 or 12-month appointments. And that's 20 hours a week, averaged over the term of the appointment.
Okay. So, okay, thank you very much. Thank you, Mr. Chair.
Thank you, Mr. Chair. I'm going to apologize in advance. I have a bit of a reputation around here for being kind of a bull in a china shop. But I'm a little frustrated in hearing this testimony. We have now passed a version of this bill out of the House several times. Eventually, we're going to get it out of the Senate. And eventually, the governor will sign it. The sky is falling scenarios about risking R&D money and how we have complex employee categories and we're never going to be able to do it if we do this, is falling on deaf ears. It is a little disingenuous. In fact, it's very disingenuous. Eventually, this is going to happen. This is going to pass. And I hope it does this year. And I voted for it for every single year, and I'm going to vote for it again this year. And all you do when you come here and testify in the way that you have is to drive a further wedge between you and your faculty and your graduate assistants. So I am asking you right now, please drop all this, get together with your faculty, get together with your graduate assistants, get together with their union, and work this out this year. Because eventually, we're going to have to work it out for you. Can I ask you to do that, please?
Isn't that so?
No, it's a question.
Can he ask you to do that?
Can we get this resolved this year? All right, thank you. I appreciate it.
Delegate Resnick does raise a good point that this committee's passed this bill before. Are there other questions? Delegate Corman?
No, Mr. Chairman, I think you've covered it.
Okay. Delegate Harris?
Appreciate it, Chair. And I'm just going to piggyback just a tad bit on my fellow colleague, because, you know, we sat here and we listened to pretty much each one of you talk about pay, talked about mentor-mentee process, but not once did I hear you talk about the process of listening and acting on workplace bullying or the low morale in the workplace environment. So what's the plan to take care of that for your work, for your faculties and graduate students?
Well, for graduate assistants, we do meet regularly with the Graduate Assistant Advisory Council as well as graduate student government, and we do listen to these concerns and we do respond. We have an ombudsperson who's available to meet with any graduate student to try to work through informally any difficulties they may be having. That includes meeting with a faculty mentor or advisor, meeting with the chair if necessary. If that fails, we have a formal grievance process. And there can be sanctions against faculty who are found to engage in abusive behavior. So we do have policies and processes in place to deal with such situations.
On the, go ahead. Graduate students.
I'll continue on the graduate student. I meet with the Graduate Student Association once a week during their weekly meeting. So I hear that from them every week. We work through issues. We talk about things that are currently on campus, whether it's campus climate, whether it's current events that are impacting students. And so that is very much part of the role within the Dean of the Graduate Students Office, or the Graduate Students Office. I can almost speak at this point. It's been a long afternoon.
Long day, yeah.
Thank you.
Thank you all. Thank you all for your testimony and being here today. Delegate Foley, thanks for picking up the baton on this bill. And we're standing by for the Senate, so we hope we can get it out of there, and we'll pick up the baton at that point. That concludes the bill hearing on this piece of legislation. We'll now move to our last bill of the day, Delegate Forbes, House Bill 541.
Thank you, Chair Barnes, Vice Chair Chang, members of the Long Haul Appropriations Committee. For the record, I'm Delegate Kathy Forbes. I'm here with HB 541. It's a state retirement and pension bill. I won't bury the lead. It codifies existing practices. So for non-vested members who become former members because of their death, this bill says that their accumulated contributions will go to their designated beneficiary. If they failed the designated beneficiary, their accumulated contributions will go to their estate. And it is that simple. I ask for a favorable report. I'm happy to answer any questions. And thank you.
I did want to let everyone know, I've talked to Delegate Forbes about this. We had 2 corrective issues come to us after the Joint Committee met, so we weren't able to ask them to sponsor this legislation. This bill would be a great vehicle for it. I've spoken, like I said, to Delegate Forbes and to your staff about the amendments, so we're hoping to bring them to the subcommittee when they meet, so stay tuned. This is going to make this bill super exciting.
In the chair, pensions we trust, so we'll stand by for her lead on that.
She'll consider it.
Excellent. Any other questions for the sponsor or the panel? All right. Well, thank you all. That concludes our hearings today. Have a great Valentine's Day, everybody.